This is Jeannie Hovland, Haumadakiabi Chante Washte Napechu Zapishto, Jeannie Hovland Amachiabi, Isantioyate Matahan, Commissioner to Administration for Native Americans at Wowashi Ichamu. Hello, my relatives. I greet you with a good heart. Again, I'm Jeannie Hovland. I'm a proud member of the Flandreau Santee Sioux Tribe, and I'm Commissioner of the Administration for Native Americans. So welcome, relatives and colleagues. Thank you for joining the Administration for Children and Families 2020 Annual Tribal Consultation Session. So glad that you have joined us virtually. This tribal consultation is a foundational component of the federal and tribal sovereign relationship. We are pleased that you have taken the time to join ACF as your words on behalf of the health and welfare of Native communities truly matter. At this time, it is my honor to invite Ms. Vivian Corthius, who is the Chief Executive Officer of the Association of Village Council Presidents and valued member of our ACF Tribal Advisory Committee from the Alaska area. She is going to go ahead and provide an opening prayer. Vivian?
Thank you, Jeannie. Just to confirm, can you hear me?
Yes, we can hear you. Thank you.
Thank you. Good morning, everyone. Let us pray. Lord, through your mercy and grace, we come together throughout our nation, assembled to address issues challenging our country and our homelands. Like our ancestors who paved our way, we ask that you shower your blessings upon us as we come forward today from every corner of the country. As we meet, touch our minds with your Holy Spirit. As we speak, bring out the knowledge, confidence, and determination to help our people. As we listen to each other's testimonies, allow us to hear the need that we have been asked to do, seeking a pathway to move forward with an open mind and a caring heart. As we go through today and tomorrow, allow us to feel your peace and the peace amongst each other. Through your guidance and wisdom, touch our minds and our hearts with your blessings. In Jesus' name we pray, amen.
Thank you, Vivian, for opening our session in a good way. As I mentioned, my name is Jeannie Hovland. I serve as Commissioner of the Administration for Native Americans. This is a dual role, so I'm also the Deputy Assistant Secretary of Native American Affairs within the Administration for Children and Families. I want to acknowledge the ACF Tribal Advisory Committee members. Vivian is one of them. We have our Tribal Advisory Committee members from 11 regions, also 2 at-large representatives. They represent our tribes from across our nation, and I tell you, their input has been invaluable to myself and to ACF leadership. I truly admire and appreciate their strong advocacy for their communities and their regions, and I want to say thank you to our ACF Tribal Advisory Committees who have joined us today. Also, before we start our consultation session, I feel it is important to acknowledge the recent and tragic events in our country. As Native Americans, racial, economic, and health inequity, as well as violation of trust, is nothing new to us. The horrific death of Mr. George Floyd is a sobering reminder of the traumas experienced by our people and that our work for equal respect and fairness is not over. Since May 25th, which happened to be Memorial Day and the date of Mr. Floyd's tragic and unjustified death, many Americans have come together to call for change. Individuals of all ages, all races, and of all backgrounds are standing together for the cause of racial parity and basic human rights. We have a powerful opportunity before us to educate and unite. Mr. Floyd's death must not be in vain. Wherever you are, continue to stand for justice, human equality, and pray for our nation's healing. Our children's future and our communities depend on it. I'm now honored to introduce our tribal moderator for today, Mr. Chairman Jeremy Sullivan of the Port Gamble Squalam Tribe. He is also part of our Tribal Advisory Committee. Mr. Chairman, thank you for joining us today.
Thank you, Commissioner Hovland. I appreciate the opportunity to co-chair with you today, and I appreciate your staff and all the help they have provided. Thank you, Vivian, for that powerful prayer today. Hottenson Stayacha, Jeremy Sullivan Sinsna. Thank you, friends and family. My name is Jeremy Sullivan. I am the son of Diana Purser and Melvin Sullivan. I've been on Tribal Council since 2005 and chair of my tribe since 2009. It is a great honor to serve my tribe. It is a great honor to serve on this committee. Growing up, we didn't have many or no social services on our reservation. Even 21 years ago, we had hardly any. We started self-governance in 1994, and when we did that, we expanded our services for our tribal members. We offer so many services on our reservation now, it is phenomenal. We were the first in the country to offer the Title IV services, meaning we could license foster care homes, and we can get children into foster care programs and homes faster. Our tribal members can pay and receive child support on our campus. We were involved in the pilot program for our SNAP food benefits, which has helped our families in need. We have a concerted effort to keep our families and individuals out of our court system if we can help it. We have a great vulnerable adults program that has many aspects to it and that has helped so many people that need that assistance. As an example, we utilize a protective payee, which is not always easy, and our tribal members do utilize it when they have to have that kind of service. Our court system is on the same campus as well as our health and wellness programs. And we have developed a wraparound service approach. During this pandemic, we had a lot of people take advantage of our LIHEAP program, energy assistance, TANF, and our food bank. We offer many of our opportunities for our community. I just wanted to highlight a few for you. I also would like to acknowledge that and thank Marilyn Nelson and Jolene for getting many of these off the ground, and Cheryl Miller for keeping that momentum going. We as a community are truly grateful for your staff and all of your hard work. Having all of these services on a reservation has been a true blessing. We need to remove any barriers that prohibit the other tribal communities from getting these services and get as many of these opportunities out to our tribal families as soon as possible. Thank you for the opportunity to serve with you guys, and I would like to take this opportunity to cover a few quick housekeeping items before we begin. This consultation is being recorded so that an accurate record can be made of today's discussion. During today's consultation, we will follow the protocol of tribal leaders having the opportunity to speak first, followed by a designee, and then open up the floor to others who would like to ask questions or provide comments. We ask that when your time to speak, that you would please provide your name, title, tribe, and or organization affiliation to help that everyone has the chance to speak. Please keep your comments as brief as possible. You will be on listen mode only during the duration of the consultation. When you are ready to give a statement or ask a question, please click the icon of a person with their hand raised that is located in the upper right side of your screen. This will alert the operator that you would like to speak. For those on the phone, please press *# on your keypad. You may also submit questions or comments by typing them into the chat box. Comments in the chat box will be retained as part of the written record. The record will be open for 60 days, and written testimonies may be submitted during this time to anacommissioners@acf.hhs.gov. Commissioner Hovland will now begin the formal consultation.
Damier, thank you, Mr. Chairman. We will now formally start the consultation and begin recording. I have the pleasure of introducing the Assistant Secretary of the Administration for Children and Families. This will be our beginning of session where we have opening remarks and discussion with the Assistant Secretary, Lynn Johnson. I want to say I'm so appreciative of her strong leadership across ACF, and I appreciate that she always makes tribal issues a priority of hers and a priority of ACF. Secretary Johnson. Secretary Johnson, if you are speaking, you might be on mute yet.
Thank you so much for reminding me of that. Good morning and or good afternoon, depending on where you are today, which is what is one of the most unique parts about doing these consultations virtually. We're all on different timelines. But Tribal leaders, tribal representatives, and colleagues, it is always a privilege to consult with you on the vast array of programs within the Administration for Children and Families that partner and serve Native children, families, communities each and every day. The past months have been extremely difficult for all Americans as our lives have changed in response to the COVID pandemic. Today, I want to specifically acknowledge the substantial toll that COVID-19 has taken on Native communities in terms of illness, death, and economic loss. Communities are hurting, and our hearts go out to tribal nations and Native people who have been drawing on their culture and resilience to move forward in a deliberate and powerful way. ACF stands and will continue standing with you to recover the health and well-being of all Native people. ACF colleagues are also suffering from the devastating death of George Floyd. ACF staff come from all backgrounds and represent all sectors of our society. Our joint vision, a country where children, youth, families, individuals, and communities are resilient, safe, healthy, and economically secure, is based on a belief that we are all connected and are equally deserving of the best that this great country can offer. ACF, like few agencies in the federal government, works to protect individuals and families from the violence and injustice that touches so many lives. I shared with my ACF team a few days ago that I could not agree more with Secretary Azar's recent statement to HHS staff when he said, "All of you can take pride in the fact that you are part of a department that works toward a more equal, more just America." We protect and enhance the health and well-being of all Americans, and that means placing a special focus on those who suffer marginalization and discrimination. For tribal leaders who follow HHS consultations, you know that ACF and our sister agencies would have engaged with you during the annual tribal budget consultation session. This would have taken place before the department engaged in formulation of the fiscal year 2022 budget. Because the departmental meeting was canceled, tribal leaders were asked to submit their comments via written testimony. I want you to know that ACF reviewed every written testimony. During this annual ACF Tribal Consultation session, you have all of the heads of our program offices present and can engage in discussions about your priorities. For example, we have noted tribal requests regarding funding for the Tribal Early Learning Initiative. Of note in the written comments is the direction that ACF is taking toward integrating services, especially for early childhood services. The tribal testimony urged ACF to support scaling up this work, and you will have the opportunity to discuss this more fully with Dr. Bergeron and Commissioner Hovland in the session that immediately follows this conversation. You will also have the opportunity to explore strengthening the Tribal Head Start program further with Dr. Bergeron today as well. We also received testimony about the importance of maternal, infant, and early childhood home visiting, the McV program, and the importance of models for working with Native communities and families. You'll have an opportunity to speak with Director Shannon Christian about the Tribal McV program and your recommendations related to the Child Care Development Block Grant and the Set Aside for Tribal Child Care programs. You have made your voices known about the importance of Native language programs, and Commissioner Hovland will address that and other priorities when she addresses you shortly. And before I address my next topic, know that ACF has heard tribal leaders clearly about the importance of child welfare, prevention of child abuse and neglect, child abuse discretionary funding, and flexible funding options for the maintenance and administration components of the Foster Care and Adoption Assistance Program. Dr. Milner and Commissioner Darling will be here tomorrow, and I can speak with you about your child welfare priorities as well as violence prevention programs. As many of you know, the administration has taken a whole-of-government approach to addressing the COVID-19 in tribal communities. ACF, along with our sister agencies at HHS, such as the Indian Health Service, Centers for Disease Control, and Prevention, Substance Abuse, and Mental Health Services Administration, the Health Resources and Service Administration, as well as sister departments, have been working to address current needs. If you have not received a summary of the extensive funding support and grant flexibilities made available to ACF's tribal and Native partners, please reach out to ANA. An important funding opportunity announcement was recently released by ACF's Office of Community Services. Approximately $9.2 million is available through Rural Community Development Discretionary Grant Funds. The funds must be used to provide training and technical assistance to increase access for low-income families to water supply and waste disposal services, preserve affordable water and waste disposal services in low-income rural communities, increase local capacity and expertise to establish and maintain needed community facilities, and increase economic opportunities for low-income rural communities. These applications are due by June 30th, 2020. We want tribes and Native people to have every opportunity possible. While you focus on today, we are available and ready to talk about tomorrow. I do not want to miss an opportunity to hear from you about the path that ACF and tribal leaders and representatives must take to ensure your communities remain vibrant and whole. Because of the virtual modality for this consultation, we have limited time today, but we will open this conversation on the path forward on COVID-19 back up tomorrow. Just remember that each time I have met with you and in any other meetings I've had an opportunity to attend, your voice has been extremely important to me. I have valued the time I've spent with you, I've learned, and I've realized what I can do to help and what I can't do to help. But I do absolutely appreciate being with you and taking the time for all of us to become stronger together. So thank you for joining ACF today. Commissioner Hovland, I would like to open the lines for tribal leaders and designees to share their input and their recommendations. It was an honor to speak today. Thank you.
Thank you for those comments, Assistant Secretary Johnson. Operator, I'd like to ask if any tribal leaders wish to make any comments at this time, press *# on your phone or click the icon of the person with their hand raised to be recognized. Mark, please remember to state your name and title and tribal affiliation for the record before making your comments.
Itself and can see the screen. There is a raise your hand option at the top middle section to raise your hand, and that will notify us that you wish to be unmuted. Thank you.
This is Commissioner Hovland, and while we're waiting for folks to either uncue their phone or raise your hand, I just want to say again that the ACF Tribal Advisory Committee, we've been working hard on priorities in the communities. One is strengthening the Indian Child Welfare Act. Another is really trying to know how we can better host ACF Tribal Consultation. We know that tribal leaders have a lot of demands. A lot of tribal advisory committees, a lot of consultations, but the programs under ACF are so important. So I want to thank all of you who are participating today, and I want to encourage you to, while we have the Assistant Secretary who's been very engaged with our tribal communities and also is very familiar with ACF programs from her career prior to coming here, please speak up. You have a great opportunity to raise your concerns and questions with the Assistant Secretary. You can raise your hand and we can cue you up to speak, but also follow instructions by hitting * so that the operator can cue you in to speak.
If there are no tribal leaders that wish to speak, we can also take comments and input from tribal designees.
Can you hear me now?
Yes, we can hear you.
Oh, heaven's sakes. Okay. I apologize for that, but I'm the one that's on the call that never is without something to say. And also, I also don't like silences, so I wanted to kickstart. I appreciate, as a member of STAC, I appreciate ACF holding this consultation. I know that we've got the challenge of the pandemic, but we have to keep moving, and we've got valuable input. So I apologize that I will be leaving in about a minute right after I speak, but I'll be coming back. Mike McCurchie, who's a member of my tribal council, is on the line, and he will be giving our input throughout the day. The only, in looking back on possible improvements, is that, and I know that with bureaucracies and safety protocols that we had to work through all of the guidelines for closures, and we were closed already as a tribe, and our child care centers and our Head Start closed after that. And I know that this was unanticipated, so maybe we have the protocols in place now for the next time. But that could have moved a little quicker, I think, in order for us, or maybe just give some discretion back to tribes to go ahead and close earlier. We were concerned, our Head Start director was concerned that we would run afoul of our funding requirements, and so we waited patiently, and we did not close our Head Start at the same time as we closed our offices. But we did as soon as we were given the go-ahead to do that. And so we are reopening, and we're going to be observing all the protocols with our little ones wearing little tiny masks. And so we appreciate all that, and we do appreciate all the communication that we've gotten from ACF. So it's been a big challenge, but you guys have done a great job in communicating with us. So I want to thank you for that. Thank you.
Thank you, Chairman Payment, and I'm glad to hear about your Head Start, and I know you've had great leadership in your region in regards to the response on this. Dr. Bergeron from Head Start will be speaking during consultation, and there is some funding that is available for summer Head Start programs that tribes are eligible that have Head Start programs, so be watching for that, and again, thank you for your comments.
Operator, we are ready to hear from our next tribal leader or designee or participant.
I have enabled William Micklin's microphone to speak.
William Micklin, you should be enabled to speak. We're not able to hear you if you are.
You may speak through your computer microphone.
State your name and title and tribal affiliation.
Hi, good afternoon. This is Tribal Secretary Davey Maley from the Pueblo of Acoma, New Mexico. In the room, we have Second Lieutenant Governor Bernard Lewis, myself, and also Tribal Interpreter Patrick Ortiz on the call today. We came in a little bit late on the call, and we just heard the last end of an application process that is June 30th of this year. What was that remark? Thank you.
Hi, and thank you so much for joining us. This is Commissioner Hovland. I was talking about, I'm not exactly sure the deadline, we'll put it in the chat box, but right now the Office of Head Start has funding opportunities for Head Start Summer Program, and we will get you the deadline on that. We do have the Administration for Native Americans. Our funding is currently open. Our languages and environmental regulatory are open until July 1st, and our social and economic development strategies funding is available until July 15th. But if you're looking for the Office of Head Start Summer School Program, we will get you that exact deadline date here shortly in our chat box.
Hi, Jeannie, and this is Lynn. And what I had mentioned was the funding opportunity announcement that was recently released by our Office of Community Services for Rural Community Development Discretionary Grant Funds. And that is due by June 30th, 2020. That's what you heard. Thank you.
Thank you very much for that information and comments, and we'll be checking our email boxes here shortly. Thank you very much.
Jim Micklin, your microphone has been unmuted, so you can speak now.
If you're speaking, we're unable to hear you.
Hello, I'm not sure who's next in line to speak.
Who's speaking, please?
Hi, this is Mark LeBeau, CEO of California Rural Indian Health Board and a tribal designee.
Thank you, Mr. LeBeau. Go right ahead with your comment.
Thank you. Appreciate the opportunity to engage in formal government-to-government consultation with ACF. I have the pleasure and responsibility of working with a series of tribes in California in the delivery of Head Start and related services. At this time, I have a 6-page document that we'll submit shortly after this call, but I'd like to highlight 4 important points to bring forward to ACF for engagement and assistance. The first being a formal request for ACF to provide program instruction as related to COVID-19. The next topic is seeking flexibility in the waiver process through the Office of Head Start. The third topic that I'll discuss in a moment is emergency funding support for the purchasing of trailers. And then the final short topic I'll address in a moment is federal monitoring. So topic 1 regarding requesting ACF provide program instructions as related to COVID-19. Throughout the pandemic, federal agencies have set out guidelines on how programs may proceed during this situation. Many of the documents discuss flexibilities that programs have in addressing Head Start requirements, always deferring to local public health agencies or local government directions. Though this is appreciated, the language used in these documents disseminated by the federal agencies are very open-ended and vague. The language as written within these documents does not leave room for Head Start programs to address local health guidance applicable to their area. The federal documents are silent on these points. We believe it is imperative that more concrete instructions be provided to grantees on this issue, because the health requirements, when applied, will not support some of the grant requirements and possibly cause grantees to fall out of compliance in certain areas. The COVID-19 virus has changed the way many industries do business. Head Start is no exception. Recommended action that we're bringing forward to ACF today is for the Office of Head Start to develop program instructions that provide clear directions to tribal Head Start programs on how to balance opposing requirements during epidemics so that programs are not left guessing or possibly being placed on the designated renewal system. Regarding the next topic on the waiver system, the Office of Head Start provided guidance that during the COVID-19 situation, grantees could request waivers on non-federal match requirements. This is also appreciated. However, the nation is facing a virus that is having long-standing impacts on school districts, local governments, and tribal Head Start programs. As the school year is approaching, the waiver request system for many of the grant components need to be simplified so that the programs are able to design their strategic plans effectively that will support the health and safety of the staff and children while still providing high-quality instruction. Have 2 short recommendations around that issue for ACF Office of Head Start consideration. We request that ACF and Head Start issue program instructions on programmatic waiver requests that allow programs to be creative in the manner in which they administer their programs during emergencies, that the programmatic waivers be placed on a fast-track process in order to help grantees affected by natural disasters or large-scale emergencies. And then finally, two more points regarding, one, funding for purchasing of modular space for Head Start grantees. During this pandemic, local public health agencies and in California have issued recommendations for reopening centers that reduce the number of children in a class to 10, along with designating an area for isolating sick children and our staff to minimize the spread of infectious diseases. In order to accomplish this, the Head Start programs will need funding to purchase or lease modulars for this purpose. And then we provide ACF guideline designation that we'll provide in the letter. Quick recommendation around that is that the Office of Head Start needs to expand COVID funding to help grantees specifically purchase or lease modulars to meet space requirements, that also addresses local health requirements to minimize the spread of infectious diseases. And then finally, regarding federal monitoring, due to the widespread of COVID-19, many grantees have not been able to continue with core work required by the Head Start performance standards and addressed in their grant application. There's still much uncertainty as to how programs will reopen in the fall. Delayed deadlines along with conflicting health and safety requirements and inability to have staff perform certain reporting duties will affect all grantees' ability to submit complete data to the Office of Head Start. Programs that are scheduled to receive their second round of monitoring in what's called Focus Area 2 for program year 2021 will be at a disadvantage. So real quick, a series of recommendations around that. We request that agency update program instructions for Focus Area 2 monitoring that take into account monitoring during national disasters, natural and disasters and large-scale emergencies. Second recommendation is to postpone Focus Area 2 monitoring for those grantees scheduled for their review in program year 2021. Third recommendation, if postponement is not an option, then the monitoring of the program that looks back at the program year 1920 should only review data collected prior to March 2020. And the final recommendation, to work with all programs affected by the closures and designing work plans that address all the areas where the program was unable to complete and to not place punitive measures on the grantees. So with that, that concludes my remarks at this time. I look forward to ACF and Head Start's formal response to these recommendations and needs. Thank you.
Thank you, Mr. LeBeau. Appreciate your comments. I will have Todd from Head Start respond here just briefly, but we will also get you an official response. Tomorrow, we will have consultation with Office of Head Start, Dr. Bergeron, also, if you can join us back then also. But Todd?
Hello, and good morning or good afternoon. Can you hear me? Just want to make sure.
Yes.
Hello, and thank you so much for your testimony, your issues raised, and also your suggestions. We definitely appreciate that. And so I'm gonna do my best to provide some updates on the 4 areas that you mentioned, and hopefully be able to alleviate some of the concerns that understandably our programs are going through right now in this time of uncertainty. I know that you discussed program instructions on the types of flexibilities that will be afforded to grantees during this time. You know, definitely Office of Head Start understands that this is really unprecedented, the state that we're in, and there are so many flexibilities that we're going to have to implement because there are so many things that at this time, in terms of normal operation and requirements, are really not feasible. And so we definitely know that certain requirements that are in the standards are going to have to be reviewed on an individual program basis, because obviously to this epidemic has impacted every community across the country differently. And so we know that even as far as returning to normal operations, that's going to vary from community to community. And so we absolutely do expect to implement the term that we've used as maximum flexibility in terms of what we're requiring programs to do. And we've said before that we are not going to require programs to do anything that is unfeasible at this time. And, in terms of issuing out a blanket guidance across the nation, we're trying to also be careful of that just because every program and every community has been impacted differently. And so we're encouraging programs to work with local health authorities to make determinations on the best and safest ways to currently conduct services or return to services. And those recommendations from local health authorities are absolutely something that we're going to be taking into consideration when we, in terms of what we're going to be holding programs accountable to. And regarding the waiver requirements, specifically for non-federal share, and I'm going to pause really quick. Chairman Allen, I'm sorry, this is Toddler Juntarango. I am the Regional Program Manager from the Office of Head Start. My apologies. In terms of the non-federal share waiver requirements, what the Office of Head Start did do was implement a flexibility for our COVID-related or CARES funding applications where programs could simply indicate they didn't have to submit a formal request to waive the non-federal share at the time of submission, but rather just to indicate on their 424s and put a 0 for where it says non-federal share or the contribution. And so that was done in order to try to expedite the application submission process. We understand that there's plenty of time to follow up within these grant years to do any additional formal requirements, but we didn't want to have the non-federal share contribution to be something that was a barrier to getting grantees to submit applications. And while we're talking about the CARES funding and that COVID-related appropriation, the Office of Head Start did shift our direction on how we were awarding that to award all of that CARES funding through a formula distribution. So every grantee received a certain amount of appropriation based on their funded enrollment, and we are leaving that up to programs to implement flexibility in terms of how they implement that, whether that be for summer programming, if they can do that, or for other COVID-related matters. In terms of number 3 and guidance for modular spacing, again, we are issuing COVID-related funding or CARES Act funding that could potentially go towards being used for modulars or additional space. Also, the Office of Head Start encourages all of our programs to identify, what we call one-time needs, which could be costs that are not normal ongoing operations. So they identify one-time needs to submit a one-time application to the Office of Head Start in our Head Start Enterprise System for consideration of funding of those needs. And typically that's where a modular or facility cost would fall under. In terms of monitoring, absolutely, that is definitely an area where I think a lot of our programs were concerned. And what we did do is we postponed all on-site reviews through the end of June at this point. Nationally, we know that there are limitations on travel, and we also know that tribal programs also in their communities have put in place certain restrictions to keep their citizens safe, and so those are absolutely things that we're respecting at this time. And so we have postponed them through June. I'm assuming if nothing else changes drastically coming towards the middle or end of this month, we'll have to be making decisions on how far out we're going to postpone them. And definitely going into FY21 and what those reviews will look like. I know our central office is working right now to identify the types of considerations we'll afford and exactly how we're going to approach monitoring, because we know that what's reflected of programs is not going to be what we normally have seen in the past due to COVID. So I'm hoping that provided some insight. I know that we'll be speaking more in depth on Head Start specific matters shortly as well, so we can definitely touch more on it then. Thank you so much, Commissioner.
Thank you. Thank you so much. And we'll also get official response. Do we have any other callers in queue?
No.
But Mr. Chairman, if we want to go ahead and proceed.
Sure. Thank you, Commissioner. Also want to thank the Assistant Secretary Johnson and all those that provided comments. And I know this is a trying time for this discussion, but it's necessary, and hopefully you guys can get your comments in either written testimony or you can type them in the chat box. We will now begin our consultation session on tribal early childhood initiatives with ACF Deputy Assistant Secretary for Early Childhood, Dr. Deborah Bergeron, and the ACF Deputy Assistant Secretary for Native American Affairs, Jeannie Hovland.
All right, thank you. I'm pleased to start this year's ACF Tribal Consultation with our priority agenda item to discuss what is happening around early childhood in tribal communities. We are hosting this consultation to launch the work that ACF is doing based on Public Law number 116-94, which encouraged ACF to convene a working group of federal early childhood program administrators, tribal early childhood stakeholders, and tribal leaders to examine coordination issues that may be impacting early childhood initiatives in tribal communities. During this pandemic, there is an even greater sense of urgency to make sure that young children and their parents are getting the support they need. We look forward to hearing from you about what you are seeing in your communities. And in order to accomplish this important task, ANA is very pleased to partner with our ACF Office of Early Childhood Development to establish our Tribal Early Childhood Advisory Committee. So this is something new. This is a brand new committee that we're establishing. And before we start the work, we want to get your input during today's tribal consultation session. I am pleased to introduce Dr. Deborah Bergeron, also known as Dr. B, Director of the Office of Head Start and Early Childhood Development, who is here, and she will be co-facilitating this listening session with me. Dr. Bergeron has been a tremendous advocate for children and families having access to Head Start and early child care and learning programs. Again, I and ANA are very excited to work with her and her amazing team. Dr. Bergeron. I see Todd is there. I don't see Dr. Bergeron in the queue to speak. Operator, are you able to locate Dr. Bergeron's number and unmute her?
Are you able to hear me now?
Yes, we can hear you. Thank you.
Okay, I'm going to turn off my phone. I tried to do the phone and that didn't seem to work. So let me just try the computer. I hopefully won't have any issues with that. But thank you so much, Commissioner Hovland. I really appreciate being here. I'm very excited about this new work on which we're embarking and look forward to getting feedback so that we can make sure it is tailored to fit the needs of the community. I'm honored to be here. We're both committed to working together and excited to hear from you about the tribal needs in the community, in tribal communities. I do wear two hats at ACF. I'm the director of the Office of Head Start and also the director of the Office of Early Childhood Development. I will have a session on Head Start after this session, so this isn't really Head Start related. We're going to focus on early childhood development in general. I have had the honor, though, of engaging with many of you during our Head Start tribal consultations, which we try to do about 6 times a year. So those are always really informative. I'm pleased that this year the Office of Early Childhood Development has been focused on strengthening internal and external coordination, collaboration, and communication across ACF and with federal partners around early childhood to improve the health and well-being of young children and their families. We are very excited to bring partners together across our federal family to support and strengthen families and promote economic mobility. And this will be important to do for our tribal communities. We've been working with other federal partners across ACF and HHS, such as Maternal and Child Health Bureau. We are working with other departments like the Department of Education, with USDA, Office of Rural Development, and our goal is to try to find the common crossroads in the space of early childhood within different offices so that we can better collaborate and catalyze partnership. We know that collaboration and coordination is important for aligning early childhood development across our programs. For example, we recently released a joint letter on May 28th with the Children's Bureau, Office of Child Care, and the Office of Head Start, and the Office of Early Childhood Development, the Maternal and Health Child Bureau, to encourage family support, maternal and child health, and early childhood programs to promote family strengthening and prevention strategies, especially during this COVID-19 pandemic, but also beyond it. ACF's vision is that every child have the opportunity to grow, learn, and be successful in life. We all know that the very first years of life are critical for building a strong foundation, for establishing secure and responsive relationships between parents and caregivers and their children. We know that Native American children and families have unique needs and significant strengths that we want to support, and I look forward to hearing and learning from all of you about what we need to do in partnership to help our children grow and thrive.
Thank you, Dr. Bergeron. And we want to open up here for your input, and we really need that. I just want to explain that I mentioned earlier about my dual role. And today I'm serving as the Deputy Assistant Secretary for ACF Consultation. So within the Administration for Children and Family, the leadership that works across the program offices are designated as Deputy Assistant Secretaries. So to align the role of the Commissioner with roles of other cross-program leadership, the Commissioner is also designated as the Deputy Assistant Secretary for Native American Affairs. This role was created by the Administration for Children and Families in 2016 at request of our tribes. As Deputy Assistant Secretary, my role is to serve as a key liaison and representative on behalf of the Assistant Secretary to all ACF program and staff offices on matters related to tribal and Native American affairs. As you know, under the Administration for Children and Families, we have 10 programs, 9 of them which provide funding or support or services to Native populations in our Native communities. So it's important, our tribes felt, to have leadership at the highest level in representation. Under the Assistant Secretary Johnson, her vision, we are charged to look at our outcomes rather than our programs and to work across silos, to get rid of our silos and work on integration of our services. So in partnership and coordination with Dr. Bergeron and myself to develop this work group on tribal early childhood initiatives, it is very much in line with the Assistant Secretary's approach to public service. So again, we were instructed under the appropriations language to develop or to host tribal listening sessions on barriers to early childhood programs for tribes. So that is the purpose of this tribal consultation. And we have some slides that if you joined us by computer, you should be able to see those slides on there. The tribal early childhood questions that we developed that would be helpful for us with an ACF to really try to have a positive, impactful approach to this. So Dr. Bergeron, if you want to talk about this, the questions for discussion.
Sure. And you know, what's really exciting about this work being coordinated with ECD is that ECD's purpose is really to build collaboration opportunities. So we really see ourselves as a catalyst for that. So it just suits so perfectly for us to try to look at where are the intersections in early childhood that can really promote thriving families in our tribal communities. So before the novel coronavirus required us to limit our travel to face-to-face interactions, we did plan to have a series of listening sessions to gather input from tribal leaders and tribal early childhood stakeholders. But of course, those plans are now being reconsidered since travel is not something we're doing. So in addition to your input on this key areas we outline in the questions for tribal leaders on the slide you're viewing now, or on the handout that you received, so you either have these in front of you one way or the other, I hope. We are also requesting your feedback that you might have on the best way to gather input, as well as any recommendations for specific tribal leaders or tribal early childhood stakeholders who should be a part of the tribal early childhood work group. and we're calling that the TEC. And so that I might almost extend that even a little further, knowing that we can't travel. Is there an ideal way for us to communicate? Have you experienced something that you think really lends itself to this kind of listening session? We want to make sure whatever we decide to do in whatever format is really effective. The TEC is going to meet at least 3 times. First for an introduction and to discuss the charge of the work group, and then once more to consider information gathered from listening sessions, and then final report that ACF will send to Congress at the conclusion of the work group. At this time, I'm going to read the questions for anyone who might not have access to them. So if you're just on the phone and you can't see or you don't have it in front of you, I'll go through these quickly, but just so that everyone is on the same page. Number 1, what are the factors that make it easier to coordinate across early childhood programs and initiatives and develop stronger early childhood systems in tribal communities? Number 2, what makes it difficult to coordinate across programs and initiatives in tribal communities? These might be legislative or administrative or some other issues. What could the federal government do to make coordination and systems building easier? Is there technical assistance? Is there monitoring? Does it have to do with funding? What do you think the barriers are? We want to know that. How does the COVID-19 pandemic impacted the ability to provide services for young children? Where do you see the impact on young children due to COVID-19? What other resources about the pandemic would have been helpful to communities to mitigate impact? In the future, what discussions need to be had to make sure certain communities are prepared in the event of a health crisis or a natural disaster? Now, in this setting, we don't need to respond to these questions in any particular order. They're just up there. They're not prioritized. We can address all of them or as many as you're interested in addressing. We're open to receiving your comments now or your questions. And I would also say if there are questions you think we missed that you think are good questions to ask, we're open really to any feedback you'd like to provide.
Thank you, Dr. Bergeron and Commissioner Hovland. Operator, I would like to ask for first, if any tribal leaders wish to make a comment at this time, please remember to state your name, title, and tribal affiliation for the record before making your comments, and please keep them as brief as possible so we can get as many in as possible.
We do have one raised hand in the webinar. Thomasine Arqueta. Your microphone is unmuted. You can speak.
Thomasine, if you are speaking, we're not able to hear you. Can you let us know if you are speaking? Also, William Micklin is still trying to get on queue with us.
We have William Micklin. William, your phone is unmuted. Go ahead, please.
If somebody.
What did you say? Rieger, can you hear me?
Hi, Lisa. Yes,
Yes.
we can hear you. Thank you.
If there are no other comments, may I make a few comments on behalf of Coconut Tribal Council with regard to the 6 questions?
Yes, please. Thank you.
Okay. Thank you for this opportunity. And thank you, Commissioner Hovland and Dr. Bergeron, for this important initiative. As you both know, at Coconut Tribal Council and our affiliates, the Alaska Native Justice Center and the Claire Swan Early Learning Center, We are extremely committed to interdisciplinary work in order to make a difference for the families and children that we serve. You may have mentioned this, Dr. Bergeron, and I missed it, but did you say who is going to be on the advisory committee and how they're being chosen? Sorry, that's one question. I can go on and just make my comments, and maybe you can address that when I'm done. As you know, Cook Inlet Tribal Council serves the 40,000 Alaska Native and American Indian people who live in the Anchorage area. And as the sole provider of tribal TANF in Anchorage and through our integrated service model, we have really embraced this interdisciplinary approach, whole family, whole person approach to make difference on behalf of our families. And how we do that is by coordinating services, matching data for participants across all areas, describing our outcomes and our impact, creating cross-department engagement and ownership from the leadership to the staff level, developing a common intake process, and those types of strategies that also include prevention strategies and tremendous outcomes, as I mentioned. I'm not going to go through all of our 2019 impacts, but we will be providing those in writing to you. In terms of the COVID pandemic, we were able to stay open, working remotely with the vast majority of our participants, keeping a crisis intervention team in person to address issues that couldn't be dealt with remotely, and we are now moving back into in-person services. With regard to the 6 questions, what are the factors that make it easier to coordinate across early childhood programs? As you both know, one of our most effective tools, and those of other tribes and tribal organizations across the nation, to achieve these priorities is the Indian Employment and Training and Related Services Act, which is commonly called 477, which allows tribes and tribal organizations to consolidate funds across different federal departments to serve families and children in the most cohesive and coordinated way. Our families don't operate in programmatic silos, and the ability to consolidate that funding is one of the ways in which the best ways in which we can coordinate across early childhood programs and initiatives. One of the ways that it is difficult to coordinate across programs and initiatives is that there are different expectations from program to program, and I'm sure you can appreciate, Dr. Bergeron, especially with Head Start and Early Head Start, that some of those program requirements can get in the way of being able to coordinate and consolidate across services. And so, as some people have already mentioned, in the time of the pandemic, the federal government has learned that systematic and simpler waiver of various requirements, including non-federal match, has really worked well and been effective, as we have also learned about telehealth and the loosening up of those restrictions that has just increased capacity and increased accessibility for those kinds of services. Similarly, removing the administrative barriers that have created impediments to fully coordinating services across different programs would be really important to do. So that's also about answering about what can the federal government do to make coordination and system building easier. Giving tribes and tribal organizations the maximum flexibility will allow them to coordinate and build systems in the most effective way at the local level to meet local needs. Tribes and tribal organizations know what is best for their communities, and the external impositions of values, programs, and reporting do not enhance the delivery of services. A second thing would be to not require technical assistance from outside entities that may not know what is culturally appropriate or best in tribal communities, and in fact don't require, for the federal agencies not to require technical assistance where tribes and tribal organizations have capacity and would prefer to internally increase capacity rather than paying external advisors on their programs. And then multiple reporting for the same data in multiple grant situations also is an impediment to coordinating and effectively working across different programs. And then finally, consider practice-based evidence as a standard of program delivery rather than evidence-based practice, which is less appropriate in many Native communities, and in a practice-based evidence model that allows for practice-based evidence to reveal the best approaches for Native communities at the local level. Obviously, remote delivery of services has been challenging during the COVID-19 pandemic, especially for families without internet or adequate technological resources, and increased flexibility in terms of how funding dollars are used. I'll address that when we get to childcare later in the day, or my colleague will do that. The last question, in the future, what discussions need to occur to make certain communities are prepared in the event of a health crisis or natural disaster? Sufficient PPE and other health resources need to be distributed to even the smallest communities to ensure preparation, and then flexible funding to allow real-time adjustments to resources to respond to immediate families and children's needs will also be really helpful in the future.
So thank you so much. I was trying to answer your first question and realized I was muted. I am so sorry. The TEC team has not been solidified. We were in the midst of starting that process when COVID hit and are just now kind of getting back on track. So that remains to be seen. I took notes on your questions. I have visited Cook Inlet and know that it is just some wonderful work there. And I think a lot of the things that you brought up are worth, that's the whole point of the TEC, is to really talk across programs, to look at where the intersections are and where improvements can be made. So I truly appreciate you sharing your
Dr. Bergeron, can I ask a follow-up question about the advisory committee? Is it going to be an internal federal committee, or are you going to have external voices, including tribal voices and Native community voices, on that committee in order to inform the federal government?
Absolutely. That is the whole purpose. Yeah, the whole idea is to be representative of the work in order to make, to look at where the opportunities for improvement are. We can't do that in a silo.
This is Commissioner Hubbard, and I also, thank you, Dr. Bergeron. I also wanted to just emphasize that we have started this, we've just started our conversations and COVID started, but we need to hear from those that are in the communities, that are subject matter experts and have experience and expertise in this. So no, we need to hear from you, and we are going to ask that if you have recommendations or suggestions who from your communities would be helpful, we want that sent to anacommissioner@acf.hhs.gov. I will put that in the comments also, but absolutely we need this to be tribally led, and we need to hear from you.
One other follow-up then to that is, the Alice Spotted Bear and Walter Soboleff Commission on Native Children is constituted, and they are going to be working in part on some of these issues, and so that might be a very good inflection point and way of connecting and amplifying voice.
Absolutely, and we are working closely with Moshami, who's been selected, represented HHS, and this, again, is all interconnected. So thank you for that.
Operator, do we have any more people that want to give comments?
Hi, this is the operator. All the phone lines are unmuted and everybody has a microphone now.
Hello.
So just remind
Hello, can you hear me?
Yes, we can.
Hello?
Hello?
Hi, can you state your name?
This is Patricia Whitefoot. I've been trying to get on.
Thank you for bearing with us, and please go ahead with your comments.
Oh, okay. Yes, good morning. My name is Patricia Whiteford, and I come from the community of White Swan, Washington, on the Yakima Reservation. And I'm also with the Affiliated Tribes of Northwest Indians, an intertribal organization that is an advocate organization for our Northwest tribes. So my background has been in early childhood education. I'm a retired educator after almost 45 years in public education and tribal education as well. And having been a former Head Start director, I want to speak especially to the role of parents and grandparents. In the various standards, we speak to the role of parents and family members. However, I just haven't heard that discussion today, and I just want to call that out, that the requirement, particularly in early childhood, that parents be involved in the decision-making that goes on in programs, it's something that needs to continue to be called out, because as families transition into public education, it becomes decreasingly, I think, a priority. And early childhood is where we see that role of parent engagement in education and policy development in the education of their children, where we can make a difference with the children from early childhood to lifelong. So I wanted to just highlight that, because it's something that I'm focusing on here in the Northwest as well. As a matter of fact, it's a part of our state plan as well as our regional plan that we're working with the Education Northwest. It's a technical assistance center that we're working with here in the Northwest that includes the Northwest states plus Alaska. And along with that, you're talking about coordination, collaboration, and of course, early childhood has called for that since its early beginnings, and it's interesting that we're still calling for that, but I'm assuming we're just all getting better at what we're doing. So just want to, I think, just acknowledge the work that ACF is doing to do that. One of the things I've been doing, and one of the issues that I found that is just ongoing, and I haven't heard this either, I think a way that early child could help us in the community that we're doing in education for our children is to really help ground our parents, our students themselves about their own identity. Ask, who are you and how are you engaged with your tribe? And even knowing your tribe, I just, like I said, retired after about 40 years in education and was teaching at the middle school. And students get to the middle school level, they're not just with their native students, they're up with other students that are part of our communities. And in our case, we're one of the largest tribes here in Central Washington, or the largest tribe here. Students, not all students are equipped to know what their background is. Maybe they're equipped, but they just don't know what their background is. And it's important, because what ends up happening at the federal level is when our children or our families are asked about our students and their eligibility for different services, we're not completing these forms correctly. Therefore, we're being misclassified, underrepresented in our native student count in our states, and also for programmatic purposes. And I'll just give one. This is based on some research work that we've been doing with the Affiliated Tribes of Northwest that has to do with, like I said, American Indian Alaska Native student identity. So what we've done is we've collected a number of registration forms from around the Northwest for education, and every school district registration form is different in how they identify Native students. And when you get the forms back from the parents, they're not always completed adequately. So if there's anything that early childhood could do, I would really strongly advocate for Native student identity. But even so with migrant education, because there are services that our children are eligible to, and they're going unmet from early childhood, particularly with healthcare needs. We're talking about, the comprehensive health support systems our children need. So migrant education is one, and so what we've done here is we've begun including our middle school students in a Native art project. And again, we're just having to educate our families and and our students about their own identity. And the way we're doing that here is called the Native Voices Art Project here in the Northwest. So using migrant resources to educate our teachers as well as our own children about their Native identity through the arts. And of course, we're integrating it with all of the standards that we have at the state level. So I want to strongly advocate that. And then I think finally, I think one learning experience that we've all had has to do with the virtual education. And if there's anything I'd like to see is I'd like to have us, follow up with some study or research work that we do on our own about the impact that virtual education has had with our families. And we know it's been a challenge for some of us, but I would like to see that done, from early childhood to at least grade 3, since we're talking about early childhood, and that would be based on similar work that was done in the early 70s called the follow-through program, which followed children from early childhood to grade 3, and I happened to teach in one of those classrooms in my early career. So I really appreciate the comments that have been made. Just want to say that as I'm listening to the discussion, I'm wondering what's being done with those plans that we put together around crisis intervention planning, for all areas of topics that we're talking about today. We just need to continue doing that crisis intervention planning and policies and making certain that we're aligning with one another, particularly at the K-12 level. So thank you. I appreciate this conversation. Look forward to the follow-up, and I will also follow up with Dr. Payment. Thank you.
Thank you so much for your comments, Dr. Bergeron. I didn't know if you had any response, but this is exactly what we need to know about. Talking about early childhood initiatives, and I'm glad that you brought up grandchildren or grandparents. That's a big part of what we are working on in all of our initiatives, as we understand, both on and off our reservations, we have grandparents that are raising grandchildren and great-grandchildren in some cases, but also the getting the identity of the race is so important, and there's a lot of challenges. Been working with the Principal Deputy Assistant Secretary, Scott Lee Can, about how we can work with our state agencies on addressing this so that we can get a better accurate count of our Native population that we're seeing through some of our state-funded services. So thank you, and we look forward to further comments on that. Also, if you want to speak in
I would say too, Commissioner Hovland, just as sort of a response, I was really excited to hear sort of that recognition that, we engage families so well in early childhood, and it just trails off in the K-12 environment. And that's something that we've been working on both within and without tribes. So great for you to recognize that. Make that part of the conversation with the CDC. I think that was great.
Some of the cold music is all there, it went off.
I just want to
I agree, but there's been programs that were done early on in the 70s called Follow Through, and I just think those kinds of models that they worked, we need to bring those kinds of models back, and research will show the effectiveness of these programs. So thank you. Look forward to your follow-up.
Thank you. Thank you. There's somebody phone that, I'm sorry. Cheryl, I'm sorry for one moment. We have somebody's phone. We can hear coughing in the background and phone ringing. So I apologize. We're missing some of the comments. If you're not speaking, I hate to ask you to go on mute if you can. But to whomever has a phone ringing right now, if you can mute it, that would help. Thank you. And I'm sorry, Chairwoman Cheryl, go right ahead, please. This is the whole part of the virtual, the technical issues that we have, and I apologize. Cheryl, if you're on the line, please go ahead.
Hello, this is the operator, William Micklin. If you're available, you're open to speak.
Can you hear me?
Yes, we can.
Yeah.
Finally.
Sinkashane Shanyanis Shuhatu. My Sinkat name is Shanyanis. My English name is Will Micklin. I'm third vice president on the executive council for the Central Council on Tlingit United Tribes of Alaska. Richard J. Peterson, president, and Tlingit Haida is the regional tribe for Southeast Alaska. We extend from Heidelberg in the south to Yakutat in the north. It's about the size of the state of Indiana. We have 32,000 plus tribal citizens, and we have several thousand outside of Southeast in Anchorage, state of Washington, Oregon, and California primarily. So I want to thank you for the opportunity to speak. I had some technical challenges here and had to get under the hood on a permission buried in the browser. That was my fault, so I apologize. So I just wanted, we've got specific recommendations and questions that we have submitted today in writing. And I'll just start with the Head Start. And thank you for the tribal early childhood questions. I will precede that with our observation that we applied for one-time funding grant from OHS, about $280,000. And that will help us set up a OHS program with procurement officer, PPE, and other safety materials. We're still researching how to open during the pandemic. We remain at phase 1. The state is in phase 2 and trying to move to phase 3. We are very concerned about the health and safety of our village communities, particularly those that are accessed only by a marine ferry or small plane, and the peril that they live under with the high risk of severe impacts from the pandemic if the outbreak is not contained and suppressed. So given that, we are looking at how to open, and our specific question is that we think it would be helpful to know whether OHS would allow programs to serve less than their funded enrollment. We have a funded enrollment of 262 children, but we think that we'll have 162 when we reopen. We are wondering if it would be possible to cut our enrollment this year in order to increase social distancing, and as the pandemic abates, move back to our full enrollment. We think that is a prudent measure to mitigate the potential for outbreak through social distancing, but it doesn't seem to be on its face permitted under OHS regulations. So that is one specific question that we have. I have other observations about TANF and the AFCAR's final rule and child care. I will reserve that for the appropriate times to comment during the two-day agenda. I will just make an observation at this point that both Head Start and child care are impacted by our ability to obtain PPE and the need for the increased operation costs
trying to knock stuff off
due to modifications needed for social distancing and disinfecting. And
well, that's what I told.
So the restrictions on use of funds, we appeal to any number of agencies and specifically through Treasury, who is the source of funding from the CARES Act for COVID-19, some COVID-19 funding, but that's the standard for federal agencies, that there be appropriate flexibility and waivers so that we can appropriately use COVID-19 for our uses. As you know, for instance, our TANF program allows us to move funding around as appropriate. The additional costs for PPE and social distancing causes additional expenses that takes from our other programs that directly benefit our tribal citizen clients. And we in Alaska are not able to access the we're not eligible for funding under Title 20 of the Social Security Act, the Social Services Block Grant, like the state is. So we are at a disadvantage because we're unable to offset the higher costs for these pandemic measures that the state is able to do. So that's kind of a TANF question, but it is applicable to our issues. I'll stop there, reserve my other comments.
Might have to do, I don't know, 2 half-day sessions, or maybe some folks are going to, there was one program that opened that's going to do half the kids at the center and half the children are going to continue doing remote services. All kinds of creative solutions, but we know you have to follow guidelines that are determined by the local and state authorities, and so we're very sensitive to that. So I would say the flexibilities for most of the things you're going to have to do are there. The key is making sure that you're documenting and that you're checking with your program specialists and running those by, you know, there are ways to make sure that you're front loading things and taking care of things so that in the end that doesn't end up, you know, being a problem. But I think overall you're going to find the flexibilities that you need that are related to the COVID crisis. We're very, very sensitive to that.
Can I have just one follow-up question?
Sure.
Go right ahead.
So, and I'll be brief. So I agree with you, and we pursued that. Our Chief Financial Officer has implemented a very rigorous system for journaling and recording costs, and associating that with our COVID-19 plan, a pandemic response plan. What my concern is with the provisions within the CARES Act and other appropriations vehicle that make very clear that compliance and enforcement is a key provision, that there are some very specific clawback provisions within the law, and what we would be very helpful is some sort of affirmation process where when we propose and document by justification use of funds that we think is allowable, that we get some kind of response to that. We were severely impacted by the drop in the stock market. We rely primarily on earnings from our investment funds in the bond and equity markets, and that the drop in that presents unrealized losses that if we draw down income as we do annually in order to fund the shortfalls within our programs, that we would realize those very significant losses. And there is no program that fills that gap for loss of income from our portfolios, and that means any clawback provision that would require us to return funds expended that were deemed unallowable would be a significant and essentially intolerable impact on our finances. So we're simply saying we agree, we'll go through that process of recordation and justification, but we're looking for some kind of process that says you're right, we agree with you, and limits our liability for clawback provisions that I anticipate are going to be fairly rigorous. So thank you.
We have Chairman Cheryl Andrews Maltius still on the line. If you wish to speak, go ahead, please.
Chairwoman, if you're speaking, we're not able to hear you.
Good morning. This is Vivian Cortez. Can you hear me?
Hi, Vivian. Yes, we can hear you.
Hi. I would like to present some prepared comments on childcare.
Okay, Vivian, and our team will work with the Chairwoman to try to get her queued up next.
Thanks. I'll try and be short. Good morning, everyone. My name is Vivian Cortez. I serve as the CEO for the Association of Village Council Presidents in Bethel, Alaska. AVCP is a nonprofit tribal organization and consortium of 56 federally recognized tribes in the Yukon-Kuskokwim Delta in western Alaska. AVCP provides governmental and social services to a region the size of the state of Washington. For the past 5 years, AVCP has undergone a quality improvement process working towards the goal of breaking down the silos and streamlining service delivery for our tribes and tribal members in 48 villages along the Yukon River and Kuskokwim River and Bering Sea coast of western Alaska. During this process, quality improvement process, we developed a tribal workforce development division, which is new. The TWD division has placed tribal job centers in over 20 of our 48 villages. These sites in our villages serve not only that village, but the surrounding villages. TANF is one of the primary funders of this new program. This program not only identifies education and training opportunities for our clients, but also barriers to employment. One of the barriers is access to quality, affordable child care. In order to meet this need and eliminate this barrier, our child care program has worked with the TWD staff and used funding to recruit new providers. We also looked at barriers of retention of child care providers that identify necessary minor repairs and renovation work to improve safety and capacity in the homes of child care providers. This model has worked very well for us, working with the division, with the job centers in our villages, and working hand in hand with the child care component of our service delivery model. With COVID-19, we have had some challenges. We've had to change or expand our service delivery model to work remotely. So we've had a lot of technology challenges that we've had to address. So I just wanted to share that because of our quality improvement process and the mindset and the changes that we've made over the past 5 years under the Tawahi demonstration project, we've had the opportunity specifically with child care to work in partnership with our TWD department to address these challenges. I have other prepared comments that I will present over the course of today's consultation as well as tomorrow.
With the Office of Head Start, Dr. Bergeron, I will turn things over to you.
Thank you so much. Very happy to still be here. Now we're going to pivot a little bit and focus on Head Start and Early Head Start. I would like to say before we do that, with the TEC that we just talked about, I really hope if anybody is interested in participating that you'll let Commissioner Hovland know. We definitely want to make sure we have a dynamic group. I think there are some really good ideas out there, so I'm looking forward to seeing where that goes. So thank you so much for coming. And I've got Todd on the phone too. Todd, are you out there?
Hi, good afternoon, Dr. Bergeron. Yes, I'm still on.
Wonderful. We're going to tag team this one. So we're going to share some information about the Office of Head Start, where we are right now, and then we'll take questions or comments afterwards. So I'm going to get started and just kind of remind you that Head Start legislation is based on the 2007 Head Start Act and Head Start program performance standards, which are from 2016. And of course, we have fiscal regulations that go alongside that. So a lot of what folks were talking about earlier, it is complicated. We do try to be nimble, but there are some things that bind us, and so we try to be flexible within the space that we have. Just an overview, you know that the funds, it had started the preschool school readiness program, and also an anti-poverty program. It serves nearly 1 million children and their families each year. Majority of programs serve 3 to 4-year-old children. However, Early Head Start serves pregnant women through and then the baby until the baby is 3 years old. And Early Head Start is growing every year. The purpose and service models behind Head Start, school readiness is the primary focus, but anti-poverty, really trying to lift families out of poverty, is a big piece of what Head Start does as well. The idea being, of course, that children who are in thriving homes are going to be more successful long-term, not just in the pre-K environment, not just in the early childhood environment, and hoping to develop the whole child for long-term success. There are a lot of different service models. We all think of the traditional preschool where you go to a center. Of course, that describes many of them, but also they can be in a child care center where there's a partnership. They could be in a home where there's a child care home. And some programs offer home-based services, which are really helpful to new moms, give them support, working with parents. Head Start programs support growth and development in a positive learning environment. So it's about health, it's about family engagement, it's about academic growth, and creating a very competent child and family that can support long-term success. OHS, the Office of Head Start at the federal level, has 12 regions. One of them is the Tribal Head Start program, and they're responsible for funding and training and technical assistance, monitoring programs, and then, of course, creating leadership priorities. And I'm going to turn it over to Todd, who is our regional program manager for Region 11, and he's going to give you some very specific information around this region and where we are and where we're headed.
Thank you so much, Dr. Bergeron, and good afternoon again, everyone. For those that don't know me, my name is Todd Lejuntarango. I am the Regional Program Manager for the Office of Head Start's Region 11, and so I'm honored to be on the phone with you all today and hear so many familiar voices and see so many familiar names, so thank you. And for my part, what I wanted to kind of go over was some of the updates and funding opportunities that are coming up on FY20 for the Office of Head Start. So one very important update that we wanted to make sure that everybody was aware of is that the Office of Head Start has posted a funding opportunity for $4 million for tribal colleges and universities and Head Start partnerships. And the purpose of this funding opportunity announcement is to increase the number of credentialed staff we have throughout our programs within Region 11. Additionally, as was mentioned earlier on this call, the Office of Head Start does continue to accept and consider what we call one-time funding opportunities, one-time funding requests, and a lot of those are around health and safety needs of programs and anything that would not normally be assumed as an ongoing annual cost. Additionally, in FY20, the Office of Head Start is scheduled to post a funding opportunity announcement for another round of early Head Start and Child Care Partnership funding. In 2020, OHS will also post a funding opportunity announcement to push back out funds that have been recaptured in previous years through under-enrollment or programs who have since relinquished. And I think one additional update that we want to make sure everybody is aware of, and some folks may be familiar and remember that last summer, the Office of Head Start opened up the Federal Register and solicited comments for a new notice of proposed rulemaking. And that notice of proposed rulemaking really focused on the designation renewal system and two conditions specifically, and those were around the deficiency condition and around the class condition. And so I wanted to provide an update, as best update as I could, to folks on the call now. So we had originally anticipated that we should see that final rule come to fruition or be approved at least, hopefully sometime this summer. Obviously, with the impact of COVID-19, a lot of timelines have been pushed back or delayed, but we are still optimistic and hoping that we will see an update and possibly that come to fruition maybe late summer or early fall. And also, just in terms of Region 11, as Dr. Bergeron mentioned, the Office of Head Start administers grant funds through 12 regional offices. And 10 of those regional offices are geographic, and they're located at various points across the country. But 2 of our offices, our regions, are what we call specific populations or special populations. Region 11 has the honor of serving all of our American Indian Alaska Native programs. And as you can see in the map, we are spread out amongst 26 states, so we have a pretty wide net that we cast through our funding and a real big variance in the types of programs that we support. And then our Region 12 program office supports all of our migrant and seasonal Head Start programs around the country. And as stated before, just a quick snapshot of Region 11, or AIAN as many refer to it. Currently, we're serving 153 grantees across 26 states, and across those 153 grantees, we actually issue and award 182 grants currently. So those are numbers, again, that continually fluctuate as new grantees are added or as grantees may relinquish or no longer be grantees. Currently, our Head Start funding provides support to over 17,000 children and their families that are preschool aged, and currently, for those children who are infants and toddlers or ages 0 to 3, we support just over 4,700 around the country. Additionally, Region 11 funds a collaboration grant as well for our National Collab Office. So one thing that we wanted to circle back with was some of the areas that were most frequently brought up during our 2019 consultations, and those were around funding, the classroom assessment scoring system, or CLAS, and federal monitoring. And so we wanted to make sure that folks were aware that those were still high priorities on our list of things to work on. In terms of actual funding to support this work we do across Region 11, for FY20, the Office of Head Start and Region 11 are projected to fund approximately $299 million to tribal programs. That figure is inclusive of about $5.6 million for the annual cost of living adjustment, the COLA, and also it includes approximately $9.2 million for our FY20 increase from Congress for quality improvement. So something we are very, very excited about. So in terms of what is currently happening around the country, we know that in early March, national emergency was declared due to the impact of COVID-19. The impacts, of course, we saw pretty much all tribal programs temporarily shut down or suspend services. Most programs, a high percentage of them, went to some type of modified remote service delivery. But we also did have several programs who actually, for the safety of their citizens, tribes decided to actually shut down or suspend services in whole to ensure that folks were observing social distancing and mitigating the spread of COVID-19. In response to COVID-19, and along with the Coronavirus Aid, Relief, and Economic Security, or CARES Act, Region 11 was appropriated approximately $19.2 million for our tribal programs. And earlier in the year, I remember it was mentioned earlier in this call as well, we had proposed to fund that through separate banks or pots, if you will, one of those being a certain amount going towards programs to provide summer programming. And since then, the Office of Head Start has made the decision to issue and award this funding through a formula-based approach. And so all of our programs should be submitting, most have already submitted, but all of our programs should be submitting their applications back to the Office of Head Start for their portion of that CARES funding. One big thing that the Office of Head Start and many of our ACF program officers did during this time was make a commitment that programs can continue to pay the salaries and benefits to support staff during this time. And as has been mentioned previously too, decisions were made to implement unprecedented levels of flexibility to try and alleviate some of the administrative burdens on grantees while they focus on COVID-19 and the safety of their communities. And so I know there was one program instruction that was released a couple of weeks ago regarding fiscal flexibilities. And of course, programmatic flexibilities, we expect to be implementing plenty of those as programs move towards reopening and reassuming normal operations. So some of the current priorities at this time where we are in the year, we're supporting programs still with around COVID-19, and that's to prepare, prevent, and respond. We are focused on issuing out the CARES Act funding, and so that actually should be coming out in just a couple of weeks. As I said, most of our programs have already submitted their applications for it, and so we are now taking a look at the technical aspects of issuing all those funding and all those awards. Full enrollment is on here. I know that, as Dr. Bergeron mentioned, there are a lot of flexibilities implemented right now around enrollment due to the impacts of COVID-19. And as has been discussed also, we expect that programs, it's going to take some time for programs to get back to full or normal operations, and that as they come back, program models are going to look very different based on the guidance received from local health authorities on the best and safest ways to reopen and reassume services. Additionally, one thing that the Office of Head Start did continue to work on during this time was exploring ways that we can improve the way we implement the class tool and monitoring. And so one thing that we're working on with several of our programs now who are actually on the schedule for FY21 is to explore a pilot working with those programs on how we would actually implement class in this upcoming year. And so lastly, one thing that I did want to, again, encourage folks to do was to continue to check in and keep up to date with our Early Childhood Learning and Knowledge Center website, or ECLKC. And on that website, we do have a page specifically for responding to COVID-19. And this page is updated frequently to try to answer frequently asked questions and also make sure that folks in the field have a place to go to get the most frequent updates around flexibilities. And so I think that concludes the actual presentation. And I'm going to actually turn it back over to you, Dr. Bergeron. Thank you.
Dr. Bergeron, we cannot hear you.
How about now?
Yes.
Can you hear me now? Beautiful. Well, I was just commending Todd for such a great job. So I will repeat that you have really good leadership here in this region, and I encourage everyone. I mean, we're here to listen today, but he's always there as a conduit from your program specialists to our office, and we do want to be particularly honed in on unique needs of this community. A really good example would be pulling out the class pilot that we're doing. That is fully responsive to a conversation that we had with tribal leaders back, I think, in early fall of last year, and really trying to listen and then what action steps can we take. So Very much looking forward to listening today and certainly addressing if there are questions that you would like immediate responses to. If I'm able to provide them, I'd be happy to do this. I do want to just highlight the slide in front of you. That website has numerous webinars that have been Ask the Expert webinars that have been posted over the past 6 weeks. We've had upwards of 150,000 viewers, participants in these webinars. They've just been fantastic, and they are not just Head Start, they're Head Start coordinated, but they are then linked with health experts.
Dr. Bergeron, your audio is cutting out.
I'm sorry, I'm in my office. I don't know why that would be. I can't really move because I'm on my computer. But anyhow, I would check out our webinars, see if they're helpful to you. They're all recorded. You can watch them and share them with your staff. And with that, I'll stop talking and just listen. If someone wants an immediate answer to something, just indicate that. And if Todd or I can answer, we.
Okay, operator, I'd like to ask first if tribal leaders wish to make any comments at this time. Please remember to state your name, tribal title, and tribal affiliation for the record before making your comment. If you're on your computer and you're using your computer audio, please use the raise hand. Or if you're on the phone, please press *# to be set in the queue.
Oh, thank you. Good afternoon. Can you hear me now?
Yes.
Excellent. I'm so sorry for the confusion. I was on my computer at first, and then I dialed up, and then I had a response to another emerging situation. Anyway, thank you so very much for hosting this, and I really appreciate these 2 days of consultation and the flexibility that's being worked into it. I did want to go back and I guess probably just reiterate the real absolute need for flexibility in how we're working with these funds and responding to this pandemic. I can't stress enough that there are so many things that are coming at us that are simply have never been anticipated, and how we're trying to address these things within the confines of the statute, and knowing full well that, there are certain limitations that Congress will probably have to go back and fix, because there was no way that we could have all have anticipated things of the unknown in the unprecedented situation. What I did want to do is go back to the redesign and space needs for, having our child care and daycare, and because most of the work that we're going to have to be doing is really remotely, because we simply do not have the space to be doing anything along the lines that we had originally planned, as well as in the Commonwealth of Massachusetts. Oh, I'm sorry, Chairwoman Cheryl Andrews Maltese, Wampanoag Tribe of Gay Head, Aquina in Massachusetts. And because each state has got their own plans and requirements, we're looking at not even being able to have daycare for a lot of our early childhood, care, and also having to reemploy calf and kin, having the children with family members that can watch them while their frontline parents have to go back to work. But the other thing that somebody had mentioned that I wanted to weigh in on was the cultural connection. And knowing full well that in a lot of cases, certain supplies are generally part of the school and education, but that our children are not going to be able to be culturally connected. We're giving up powwow. We're giving up our spring socials, our cranberry days, and all of our cultural events that we typically would have to keep our children connected. We're looking at doing some remote or web platform-based type of things and having to buy cultural supplies to keep them engaged. And I just wanted to make sure that, the agency is not looking at these funds as being as restrictive as funds have been in the past, to be able to ensure that, we're able to utilize these funds very creatively, particularly and especially when it comes to the cultural connectivity of our young children early childhood and post-early childhood to keep them connected to each other, the extended family unit culturally as we would, as well as to be able to build the cultural competency and awareness that we need to with regard to our young people. It's critical at this stage, and to be able to adapt to something that is going to keep them connected is going to be very, very important for the tribes to have the flexibility built within these funds.
This is the operator, Nigel Lawrence. If you have a comment, go ahead, please.
All right, can you hear me now?
Yes, we can. Thank you.
Wonderful. Thank you for putting this session on. I really appreciate it. My name is Nigel Lawrence. I'm the Suquamish Tribal Council Secretary, and I'm also the director of our Marion Forsman Boucher Early Learning Center. I'm next door neighbors to Chairman Jeremy Sullivan, so, good to see you virtually, Jeremy. My biggest thing is that I would like Head Start to consider making or continue considering making Indian children categorically eligible. I really do appreciate, I wrote this in the comments too, but I really do appreciate that we're allowed to go up to 49% over income as opposed to, other centers around the country, just 10%. But the thing is, families, Indian children have so many, they're just born with so many adverse childhood experiences, so many risk factors. The fact that, a family of four goes from $26,200 a year to $26,300 a year or $30,000 a year shouldn't preclude them from being able to get Head Start. I mean, if you make under the federal poverty limit, whichever category we want to be at, however big their family, they get thousands and thousands of dollars every year, almost even monthly, depending on where they live, of free, amazing, high-quality preschool, early Head Start. But once you make over that, all of a sudden that thousands of dollars disappears and dries up, and all the other categories that they are eligible for dry up. I've never understood how, a dollar under this limit, you get thousands and thousands of government, benefits. And you make $1 more than that, $2 more than that, and these thousands of dollars dry up. Why isn't there something that, I guess I'm almost talking like universal basic income. Here's the amount that everybody should have to live. And if they make less than that, here's the services they get. We know Native children have so many adverse childhood experiences. We know the risk factors are huge. And you mentioned economic mobility, Dr. B, earlier. And this is one of those things where congratulations, you're moving on up. We are encouraged to hire parents, and we do, and all of a sudden that makes them ineligible to get the services they're now providing, because luckily we've been getting COLAs every year. Thank you again for that. My tribe, Suquamish, we also started our own $14 minimum wage years ago, and COLAs have kept moving it up. And at the time, $13.85 was what cut people out of, services. And so we kind of shot ourselves in the foot there. We've spent, millions of dollars on this gorgeous building here and get grants from the state and the federal government. And those income guidelines are squeezing out our tribal members. We have this tribally run Head Start, early Head Start, and state preschool building that, we're about to, for the first time ever, serve more non-tribal people than tribal people because of the income qualifications. So, long story short, tribal children should be categorically eligible. Thank you very much.
Okay, we have Lisa Rager. If you're on, your phone has been unmuted. Go ahead, please.
Yacht A?
Yes, just state your name, title, and tribe, please, and go ahead.
Okay, Yacht A, good morning. This is Dr. Elvira Bitui. I'm with the Navajo Head Start program. Kia ani nishrindo hashtishni bashishchin sitna jini dashati don't know bani dashinale. Yat A to Director Bergeron and Commissioner Hovland and everyone else online. I would like to make reference to the first question that was posed. What are the factors that make it easier to coordinate across early childhood programs and initiatives and develop stronger early childhood systems in tribal communities? The Navajo Head Start program runs more smoothly when it receives consistent and responsive communication from Office of Head Start. Specifically, targeted and culturally sensitive teen TA is essential for effective coordination across early childhood programs and initiatives. Flexible and responsive support is what tribes need as opposed to overly bureaucratic and cumbersome requirements. The flexibility helps tribes efficiently administer their programs, and respect for tribal sovereignty and tribal self-government also helps tribes take control over their programs and respond to the needs of the community in a more efficient and supportive manner. This does not only include bureaucratic and systems in place or technical processes. The respect for tribal sovereignty and the respect for American Indian identity and way of life is important. An example of the ACF and Office of Head Start need to have a greater understanding of the effects of historical trauma and institutional trauma, and develop and create ways in which we can advance and perpetuate traditional language, cultural, and oral traditions. An example, the need for additional funding to include a Professor Emeritus program that incorporates elders as teachers and leaders. That's important to help us retain, preserve, and revitalize the language and culture of our Navajo Nation and throughout tribal nations. And this is so important, especially during this pandemic. Some of the Navajo has been hit hard with this COVID-19 virus and the disease that we are faced with. And now, we're turning to our traditional healing ways. So I think that's also important with local traditional counselors that the federal government needs to recognize that traditional counseling programs be legitimate and an effective healing model for our people. In response to question number 2, one of the greatest barriers to effectively coordinate across programs and initiatives in tribal communities is the systemic prejudice inherent within the Office of Head Start institution, staff, and representatives. While Office of Head Start does attempt to support tribes, there is a very clear lack of understanding and responsive support to tribal programs. Office of Head Start representatives provide inconsistent communication that create real barriers to the Navajo Head Start program and seriously hinder Navajo from administering its program effectively. Poor and inconsistent communication from Office of Head Start makes it difficult for Head Start programs to coordinate across programs. Specifically, Office of Head Start must respect tribal internal governance structures, or lack of difference in internal tribal governance creates some barriers to effectively administrate our tribal Head Start program. There must be greater respect to the actual needs of our tribal program. This lack of responsiveness and cultural sensitivity is a huge barrier. It's the largest barrier to effective administration for our tribal Head Start programs. In response to question number 3, the federal government must undergo extensive cultural education when working with tribes. Cookie-cutter support does not address the true needs of tribal Head Start programs, but instead further entrenches tribes in a system that inherently does not account for their true and unique needs and our circumstances. Office of Head Start must provide more culturally sensitive support, as well as accurate and consistent information. There should be a tribal liaison who has decision-making authority that is able to consistently and supportively help tribes administer the Head Start grant. The Head Start grant is one of the most heavily regulated grants in the United States. And inconsistent, inaccurate, and limited piecemeal support does not rise to the level of TTA statutory requirements by the Head Start regulations. The federal government must proactively acknowledge and address its systemic prejudice against tribes and work more collaboratively with tribal programs to ensure they are receiving the support they need, as opposed to the support the federal government believes they deserve. Furthermore, the administration of the Head Start program is exceedingly burdensome and inflexible, especially when it comes to tribal governments. Office of Head Start should allow more deference to tribal governments and acknowledgement of their sovereign rights to self-govern, as opposed to imposing strict federal regulations that do not work well within the tribal governmental systems. There should be more internal self-government of tribes and administration of the Head Start program. In response to question number 4, with the lack of necessary internet and broadband technology to provide long-distance learning across the large territory of the Navajo Nation, e-learning and e-trainings are not readily accessible, and students are already at risk of falling behind, are seeing their small chance at success in academic support being ripped away from their hands. These students must not fall even further behind just because they live on a reservation, or we live on a reservation. Closures of our Head Start centers at this time risk the nation's ability to provide essential support to the nation's most vulnerable population. And without internet or widespread telephone access, it is extremely difficult for Navajo Head Start to provide support to these young children and families. Further, Office of Head Start should ease some of the restrictions on approval of utilizing funds to address structural deficiencies, internet capabilities to tribal systems, and utilizing funds for hardware, software, servers, and connectivity. And they should allow us to, as a larger Native American tribe, to build our own telecommunication infrastructure and identifying early childhood education as a priority. In response to item number 5, the Navajo Nation needs the resources to help educate the people about what a pandemic is and what it means regarding the risk of life. This is the first time experiencing such a widespread governmental closure due to a pandemic, and to most people it is surreal, and many do not take it seriously enough to follow through with CDC guidelines and precautionary measures. The nation has a large need for food and health education for this region, and live statistical updates. The nation needs more funding for care packages and to identify what type of education packages are needed based on location and demographics. And I just want to reiterate that, we are in a state of this pandemic where it rises a lot of fear, anxiety in our people, and we don't feel like we're getting enough support at this time to properly address these areas of need. And so in response to question number 6, in the future, what discussions need to occur? In the event that this kind of health crisis or natural disaster should occur again, there needs to be a disaster plan in place, and people need to be educated in order to mitigate the disaster that could impact the communities, especially for our students. The federal government must empower communities to take back government-run programs and to have autonomy and control over their ability to help their own people. And again, just to make sure that we have the proper guidance, the proper response from the offices that could be helping us. And there is a need to have tribal governments adopt emergency preparedness protocols from essential government processes and functions to state and federal government communication. This is also a request to have Department of Health and Human Services be accountable through Indian Health Services, as they need to communicate more effectively because they have direct contact with certain administrative offices. Early childhood funding recipients need their own testing kits to ensure the safety and well-being of the staff and children. So those are our comments, and that's what we'd like to present from the Navajo Nation Head Start program on behalf of the Navajo Nation Office of the President and Vice President. Thank you.
We have Lonnie Greninger next.
Hi there, can you hear me?
Yes, we can. Thank you.
Great, thank you. Ait Squatchy, Yuchsia and Snatch, the Tislam Nusayamson, Hotningson, to Chairman Sullivan and to Commissioner Hovland for co-hosting this for us today. I really appreciate the time to be able to get on here and speak. I do have just a very brief question, and I apologize, it has nothing to do with the questions that were given earlier. But do we happen to know off the top of our heads which tribe using these funds right now is the smallest? So I guess basically what I'm trying to get at is I'm not as familiar with Head Start as I am with child care right now, and so is Office of Head Start funds and other grant opportunities, are those available to the smallest of tribes that don't have a lot of children that could be eligible versus our larger sister tribes?
I couldn't tell you off the top of my head who the smallest tribe is, but definitely there is no favoritism to a larger tribe. And that's even true outside of Region 11. We have very, very small programs in rural areas all over the country.
Okay, great. Thank you so much.
Thank you for your
Operator,
time.
do we have any more people in the queue?
Yes, this is Leanne Garrett calling from the Cook Inlet Tribal Council in Anchorage, Alaska. We have a couple of comments to add as well. From our Head Start program here, serving the Cook Inlet region, our comments are that tribes need flexibility and culturally based programming to provide the best and most effective Head Start services to families. We're so thankful for the flexibility of the COVID funding, especially during the pandemic. But when we look ahead, we've got a couple places that we could really use some improvement points. Of them, we're concerned about the impact of class scoring on culturally appropriate teaching and request that class scoring be used to promote professional development rather than punishing programs. Head Start reviewers should be trained in a growth mindset and to understand the importance of cultural curriculum. Some of our impediments to program success at the moment are requiring an annual appraisal for the use of facilities. It's a really onerous and unnecessary financial burden for our programs. And many of them, if not most of them, are in relatively stable and low market real estate markets. And so that's a tough point for us. Also not allowing administrative costs devoted to programs, but over the 15% cap to count toward in-kind when they are supporting the program limits or organization's abilities to meet match requirements and inaccurately reflect the financial burden on programs. It's really hard for us to be able to true that up. One of the other impediments to program success is allowing the E-rate for schools but not Head Start, and making Head Start and early Head Start programs more tenuous, and it puts unnecessary stress on these programs. Unlike state and local programs, tribal Head Start and early Head Start programs do not have ready access to non-federal dollars. We are urging the Office of Head Start to implement the non-federal match waiver process as a blanket waiver for the life of the program operations for tribal Head Start and early Head Start programs rather than as the annual process that is in place now. Also, it's critically important to ensure that Head Start academic standards don't undermine tribal programs' abilities to highlight culture and address social and emotional factors that provide resilience against the trauma and poverty-related issues that often rise in children served. Interventions at the kindergarten and first grade level, supported by our organization here at the Tribal Council, have documented improved physical health results, fewer trips to the school nurse, improved child welfare results, and improved academic results from looking at higher test scores. Focusing on trauma-responsive services in our early Head Start program has resulted in transformations in both parents and children's behavior right before our very eyes. The Cook Inlet Tribal Council recommends more clarity about the issue of teachers who are in the process of obtaining their CDA In our community and with the target population of parents to become teachers in our Early Head Start Child Care Partnership, we are working with our participants to get them ready to take the test and receive their certificate. However, sometimes, just because of life, it takes longer than the 6 months expected time frame, and we'd like more latitude and flexibility in using those teachers in the classroom while they're working on obtaining their CDA. CATC strongly recommends the department leave as much discretion in the tribal programs as possible in order to respond to local community needs. Tribal and tribal organizations know best how to support their families and children, and those regulations should reflect that respect by the department. Thank you very much.
Thank you for your comments. I don't know, Dr. B or Todd, if you wanted to respond.
We do have one more commenter. William Mifflin is on the line. Your phone line is open. Mr. Mifflin, if you're speaking, we are unable to hear you.
Hi, can you hear me?
There you
Hello?
are. Thank you very much, sir.
Thank you. Sorry for that.
Yes, I hear you.
So just a couple of follow-up recommendations. I agree with our friends just spoke about the waiver of the non-federal share. That's a key component. And so let me explain that we have some immediate impacts. We have a shortage of PPE, as I mentioned on my prior comments. We also have a shortage of food and basic supplies, particularly in our rural communities that are challenged by access during the pandemic, and with the already imposed and continuing state budget shortfalls that has limited marine ferry access to communities, made barge shipments very expensive and periodic, and has raised the level of need amongst our communities. We have a number of recommendations. One is that there be hazard pay for providers and caregivers and aides who continue to provide care during the pandemic. That we allow our providers to purchase what is needed to maintain facility service requirements, such as food, safety equipment, and other things that are very difficult and costly to provide at this point. That we talk about providing a safety net for providers and parents as needed on a case-by-case basis, and what type of flexibility would allow that type of support. That we address the rising costs of operations, and as well as the cost to our clients who are our clients in our programs, and that we ensure that as our friends at Navajo stated, and this is somewhat of a crossover to tomorrow's comments about the FY 2021 budget recommendations that extended guidance to tribes for directly funded Title 40 programs, that spoke to the use of evidence-based prevention services that allow for cultural adaptations for approved evidence-based services. So I'm really pulling out the cultural adaptation. We are fully embracing our cultural traditions and practices, and think that our outcomes are better when we apply those in our service programs. So I think that merits a discussion on how to extend those cultural practices so that they become approved evidence-based practices in the future. We think that is a significant need in our community. So thank you very much for the opportunity to speak.
Dr. Bergeron or Todd, would you like to respond to any of the comments provided so far?
I think that specifically generally, I would just say that the desire for flexibility is something I completely understand. I can definitely see how programs have unique needs, and we want to try to provide the most flexibility we can within the legislation that we have in front of us. So that's what we aim to do. Certainly the CARES funding is giving an awful lot of latitude. So when you talk about wanting to buy PPE and that kind of thing, that money can be used for that. So if it's to lower ratios, increase hazard pay, whatever it is that you think is most important, we really left that very open for programs. And I hope that's been communicated properly and that folks understand that. The other general comment I would make would be around class. This is something that Todd has really done a phenomenal job leading in Region 11, and he and I are working to try to move the needle on this. It's challenging because it is in the legislation, but we think there are some opportunities to try to be responsive, and so that's the reason that pilot is in place. We need to make sure that it works first. And if so, then maybe it's something we can actually parlay out into the field in general. But we've really tried to move class to a more responsive growth mindset tool that helps programs become better at what they do. And those were the two kind of recurring things I heard that I want to just generally respond to. I did make some notes about some specific items. Obviously, we'll get all of this in writing and we'll work to have written responses, but there were a couple of other things that I actually want to tap into some other folks on our leadership team to find out some more detail, and we'll make sure that's included in our written response. Todd, I'll turn it over to you if you have any comments.
Thank you, Dr. Bergeron. I think in listening to the comments, the only general comment that I wanted to make was in response to some of what we heard around language and culture. And I think one thing I definitely want to make sure that we're clear on is that for a long time, the Office of Head Start heard from tribes about the importance of language and culture and the need for increased flexibility around implementing language and culture in the classroom and including that in your curriculum. And so, I was really happy to see that in the revision to the Head Start program performance standards in 2016, it's now a requirement that programs are both culturally and linguistically responsive to the community that they serve. And so I want to make sure that none of our tribal programs ever see requirements as a barrier to infusing their language and culture in the classrooms and putting that as a priority for what you want your children to be learning. Thank you.
Great point.
We do not have any callers in queue at this time. Tribal leaders, tribal designees, if you wish to make comment, please raise your hand or press *# on your phone. The raise your hand button at the top center of their screen.
Hello, this is Lorraine Gouget, Vice Chairman of the Lakota Ray. Can you hear me?
Yes, we can. Thank you very much, Lorraine.
Yeah, I'm sorry I was late joining the conference this afternoon. I was in another meeting, but I was listening to all the comments and all the tribes that were speaking and addressing early Head Start programming, and I'm in line with some of those. I didn't have anything drafted up specifically. I've just been having so many meetings. But I did want to say, for my tribe, within our programming, we did the best we could during this COVID with what we had and to keep engaged with our children and the families and within the community. and we took every measure we could to deliver what we could as far as learning tools, food source, having some kind of contact, even though we were on restriction, the best way we could to keep engaged. We're trying to keep that learning going across the board. But with the program itself, I was listening to the ideas and concerns that were being brought forward, and the cultural component really stands out, and keep adding and building that within our curriculum and within what we're teaching the children. But also the one area, the mental health. Within my community, we, of course, are addressing the COVID-19, but also the opioid, the drug addictions, the broken families. So we're seeing a lot of that stress at all levels. And when it comes to these little ones, I just want to keep that a part of our programming so that we can keep that support in place for them. And the flexibility is very important during this time. We've been trying to do everything that we can. We always have these guidelines, always have these stipulations, always have these things we've got to stay in line with, but there's times we don't know. All of us across the nation are experiencing different levels of this crisis, and so the flexibility is very important, very important. I do want to say I really appreciate what we have here for our early Head Start and our Head Start programming. I'm telling you, for our children, it is helping them to be ready for kindergarten readiness and for them to be given the healthy support that they need to be able to help those families to become more self-sufficient, to be able to learn, to keep learning and engaging. Very important within my community. I really want to thank you for that. And as we're coming across these ideas and concerns across the nation here, I'm like I said, I'm listening, I'm learning. I don't work directly with our program, but we do have oversight, and we do have, we are a part of that. I did not have a written report, like I said, but I did want to acknowledge what we do have and to thank you for that programming that exists here. And as we move forward, we're continuing to provide that care, and we're also trying to provide that needs now for our workers that are coming back to work. We're calling them back now, and for child care. We do not have, that's one thing we do not have within my tribe, is a child care facility. And so we are trying to develop that piece too, to work kind of with the other program that exists, however, to meet that a larger need that's out there. At this time, though, within our facility, we are programming a way to help, because the Head Start programming is coming to the end now of their school year, and then the early Head Start will continue to what they can provide, but if we can help for more support for the essential workers and the workers that are coming back into the workforce now. So, but I just wanted to let you know I have been listening. Sometimes I may not speak, but I do listen to what's being said, so I want to acknowledge that to all the leaders and all the representatives there in this department, that it's always good to have these ideas and to hear from us in different ways so that you can take back to where you are at to help keep building on what we have in this area. So I'd like to thank you, Jeannie, and your staff for, again, listening to what's happening. We've had so many meetings. We've had so many things happening for my tribe that there's times that I'm either late or I can't be part of things, but I do really appreciate being a part of things when I can and hearing what I can hear and listening to where everybody is at across the Indian country. With that, I'd like to say thank you, and I will continue to listen.
Thank you, Chairwoman, and thank you for your continued advocacy. I know you're on so many of the calls, and you always speak up, and I really appreciate your voice and your insight, so thank you.
We have one caller in the queue, Gil Weigel. Go ahead, please. Gil, if you're there, can you please speak up? We cannot hear you.
Hello, can you hear me now?
There you are. Yes, we can. Thank you, sir.
Good afternoon. I've been trying to figure out this technology, and I guess I got my smoke signals together, so I'm on the line. Good afternoon. My name is Gil Vigil. I'm the Executive Director of the 8 Northern Indians Pueblos Council and also former governor of Tesuque Pueblo and a lifetime councilman. Thank you for all the presenters that talked about Head Start and their issues and concern, especially with this COVID-19 situation. I think it's given us a different perspective of how we deliver services and how we do our work. Sometimes it becomes challenging, but I think we're still continuing to do our work. For us here at 8 Northern, we have 2 centers that we still administer, Nambe and San Alfonso. And so we've been continuing to do our work as far as providing meals to the kids and then doing some homework stuff, virtual education, if you will. And as I've always stated, Head Start works, but as other comments were made about the problem with Head Start, it was created in a poverty era. Well, I think because Head Start works, a lot of our people that have went to Head Start are now professional people, and yet their kids aren't eligible. For me, I think Head Start should be more of an educational program where it offers services to all our young children, because as we all know, education starts at an early age. And if we start at an early age and develop a program, not just for the kids, but for the families, the communities, I think we see better results. So I feel that, and I've always made this comment, and Ann Linehan always should say, Gil, here comes Gil talking about our standards and regulations. And I still say that there's too many standards, too many rules and regulations that prohibit us from doing some of the work that we want to do. And having said that, I think one of the questions was to move into make improvements of early childhood programs. Here at Northern, we're looking into home visitation. We're looking at early learning centers. We're looking at, and I guess that's where this question about flexibility comes in, to allow us that flexibility so that we can incorporate all the programs that are out there, to utilize these programs in a best way, designed by the communities, by the pueblos, by the tribes, of what that program looks like. Todd commented about the performance standards of 2016 allowing for language and culture to be part of a Head Start program, which is wonderful. We've been talking about that for a long time, and finally in 2016 it was made part of the standards. But I think, having said that though, the standards have to be developed by the tribes, because the tribes are the only ones that can talk about whatever culturally appropriate programs are. And so it's important that we look at that on a tribal perspective and get that information, because as we see it today, there are a lot of things that our young people are being subjected to. Somebody talked about the behavioral part, and certainly that's an issue. A lot of our communities, in our efforts with our home visitation, we did a community asset mapping, and the community, we created teams, and the teams were the ones that identified some of the issues in our communities. For example, we still have alcohol, drug abuse, we have domestic violence, and the main one that came out was the loss of culture and language. You lose your language, you lose your culture. And a lot of the other issues of drug abuse, domestic violence, that's still going on in our communities. And we have to address those things, because some of the kids are in those homes and they're saying these things. In fact, with the work of the National Child Welfare Association, which I'm the president of, we find out that 90% of the kids being removed from their homes is because of alcohol and drug issues. And so these are the things we want to address and cure. So I think my point is that Head Start works, but we got to make it eligible for everybody without income requirements or any of these things, because for a tribal leader, it's our responsibility to take care of all our people in our communities. And that's what we want to do. And so I think, again, I will provide a written testimony to my comments that I made, but also I think we need to be more flexible in how we do our work. Thank you.
Thank you, Gil. And I am, Anne may be on this call, so she might be eavesdropping, but if she's not, I'll make sure that you say hello. We always appreciate your comments very much, and we'll take them, take the comments back to the team, and we'll talk about them and do what we can for sure. Thank you so much for everything you do.
Thank you.
That is the operator. We have one in queue.
Operator, this will be the last comment, and any additional comments in the chat box, as well as you can send additional testimony in writing for any comments or testimony we did not hear today.
Am I still on the line? This is Gil. Am I still on the line?
Yes, you are.
Yeah.
One thing I forgot to mention also is about enrollment. Many of our communities, we're not big populations. And so we have to be flexible in how we get our community or our kids eligible for Head Start. Because like I said, we're small communities and sometimes we don't meet those numbers. And so we need to be flexible how we address that also. Thank you.
Jeannie, we're ready for the next session.
Okay,
All right.
we will now, I'm sorry.
I'm sorry,
Commissioner?
Mr. Chairman, go right ahead, please.
Okay, thank you. We will now begin our consultation session with the Office of Child Care. I will turn things over to the Office of Child Care Director, Shannon Christensen. Christian. Director, we cannot hear you at this time.
Okay, I got it now, I think. How about, can you hear me?
Yes, thank you.
Okay, good. So good afternoon. I appreciate this opportunity to hear from you about the important topic of childcare and how the programs that we fund to subsidize childcare and improve quality are working in your tribal community. The concept of economic mobility, particularly self-sufficiency, including supporting and protecting the vulnerable, we know is a core value throughout Indian country, and it is also a priority of ACF and the Office of Child Care. We administer the Child Care and Development Fund, which we call CCDF, which is over $489 million have been invested throughout Indian country this year. This includes $96 million from the CARES Act, which provides assistance for essential emergency responders, medical personnel, others, to support and maintain the pool of child care providers. So those are the two. You can use that new money for anything that is a child care related problem due to COVID, but the direction from Congress was make sure you use it to support emergency essential workers and to maintain the pool of child care, the providers, the businesses, while they are either closed or enrolling far fewer children during the pandemic so that when it's over, they are there to open up again. So we'll be interested in hearing how that's going. As an update, I want to mention that there's an increased number, 44 tribes who have consolidated their CCDF program under 477. As you know, the 477 facilitates integration of funding for employment training and related services from diverse federal sources to meet the needs of local and tribal communities, and more people are interested in including child care in that program. So what do we do at the Office of Child Care? We administer the Child Care and Development Fund, CCDF, which is a block grant to state, territory, and tribal governments that provides support for children and their families by paying for child care that will fit their needs and that will prepare children to succeed in school. And it's not just the early childhood, it's birth through age 12. We support low-income working families by improving access to affordable, high-quality early care and after-school programs, while also valuing parent choice across types of child care settings, whether that be centers, family child care, or family friend and neighbor care. We improve the quality of care to promote children's healthy development and learning by supporting child care licensing, quality improvement systems, and to help in programs meet higher standards, and also training and education for child care workers. We've established and oversee the implementation of child care policies and provide guidance and technical assistance to states, territories, and tribes as they administer the programs. On the call with me are some of the key people from our leadership team, and they are available as needed on this call. Andrew Williams, who heads up our Policy and Data Division, John Ramsberg, who heads up Operations, which is where the Child Care and Development Fund plans are located, Jim Henry, who leads our Office of Child Care Tribal team across all the different issue areas, and Ginny Gipp, who heads up Technical Assistance. We look forward to hearing about what's happening with your child care programs, your successes, your tough issues, barriers, any ideas about what we can do to help, and anything else you want us to know. While we mostly do the child care program, it's important to note that we also have the Tribal McVie, the Maternal, Infant, and Early Childhood Home Visiting Program. So if there are questions related to that, let us know. Now I'll turn it over to all of you so that you can tell us what's on your mind. Thank you.
Operator, I'd like to ask first if any tribal leaders wish to make a comment at this time. Please remember to state your name, title, and tribal affiliation for the record before making your comment. Please keep your comments as brief as possible.
There's one person in the queue. Yes, if you're calling from 208 number, you can go ahead and speak. You may be from the last presentation now.
Yes. Sorry, I was trying to jump on the earlier one, but it didn't go through until now.
That's okay. Go ahead with your comments. Thank you.
Please state your name, title, and tribal affiliation, please.
Okay, my name is Chantel Green. I am currently filling the secretary position for the Nez Perce Tribe Executive Committee. And I wanted to relay some information that came from our early child education program. So from our program, they wanted to relay some of the issues that they had for their facility. They would like more guidance on how to prepare a facility application and secure necessary funds and guidance on the webinar or workshop sessions. Individual programs need one-on-one assistance to accomplish the goals of a new facility. Social distancing for all of HS, EHS, and child care classes. To improve facilities to provide outdoor learning and upgraded playground facilities. They also need assistance with recruitment and retaining qualified staff, especially tribal and American Indian Alaskan Native. They will also need more staff for social distancing efforts to ensure student-teacher ratio to provide increased cleaning and sanitation, as well as having experienced staff. They're experiencing staff shortages as of right now for education, the health and nutrition, the food service, custodial, family services, and administration, as well as issues with the remote learning and how to prepare and execute. Some families do not have the capabilities for virtual learning due to the lack of internet in our area. we also live in a rural area, and our tribe is actually trying to connect fiber connectivity so that we can increase those. However, during this pandemic, it's been an issue in getting remote learning to our families. Inadequate equipment, we need training to support remote learning, the documenting and the progress and outcomes and family engagement, as well as providing remote services and how to prepare and execute. Similar to students and families, staff may have the necessary equipment and connection capabilities for remote work, and so we need to upgrade our technology for that. To suffice, basically through Zoom, our teachers have been utilizing their own cell phones via Zoom and just any means that they can find possible. And then how to plan for duration requirements, the 1,200 hours in light of the pandemic and possible second wave. Will programs be required to meet the EHS duration hours for 2021 program year? And looking at May needing to transition to AM, PM classes to support social distancing in the classrooms, and limiting the children within. Immunizations, health and medical and dental screening for children and prenatal. Will time requirements be waived to obtain necessary screening due to pandemic as a tribal health clinic, limited services to emergency only. Some more of the policy level related questions, also to retain tribal specific language through Head Start reauthorization. The Head Start for tribal programs that return needing to stay, funding to stay with the region. We oppose the class observation instrument as it has not been normed for American Indian, Alaskan Native, as well as OHS and tribal programs need to collaborate on very critical issues impacting tribal children and families. Tribal consultation, which we can always improve on from government to government. We oppose the lowest 10% for class as a designated minimum trigger. And to create a process for any guarantee who operates early Head Start and Head Start to convert the 2 grants into 1 birth to 5 grants. And to ensure the federal monitoring contract provides cultural competency and training regarding the inadequacies of tribal governments and cultures. And I will also like to provide this into a written testimony as well, or comment, so that we can hopefully get some answers and then communicate further on a later date for consultation. Thank you.
So it's Shannon. I don't know if you can see our slide, but we threw up a couple of different topics that we thought people might be interested in talking about with us. And if no questions come up, we have a couple of questions for you all. So let's wait a couple minutes to see if we have comments, but if not, we might have our own questions where we may need feedback.
Is there any tribal leaders or tribal designees that wish to provide comment? Please select the raise your hand icon in the top middle of your screen, and you'll be put into the queue. For callers on the phone, please press *#, and you'll be put in the queue to speak. Thank you.
Maybe while you're thinking, I know the list of items that we just heard were Head Start items, but some of those things can be funded with CCDF money, and where there are joint programs or it's allowable, it might be good to know what we can fund. Andrew Williams, do you want to say something about that?
Mr. Williams, are you dialed in or are you on the webinar? I'm unable to unmute your line.
Sorry, can you hear me? Can you
yeah,
hear me now?
Great, Andrew.
Okay.
Yeah.
Sorry about that. Yeah, so CCDF can be used for construction or major renovation of child care facilities with approval of ACF, and can also be used for minor renovation of facilities. So if you had a child care facility or a joint Head Start child care facility, that's a possibility. In addition, CCDF and the supplemental funds that were provided under the CARES Act can be used for not only direct services, but a range of quality improvement activities, including personal protective equipment and other items to address COVID-19 as well.
What about any of the IT needs, Andrew?
So yes, so IT, CCDF can also be used to pay for child care information systems. And that those costs do not count against the 15% administrative cost cap. So that's an allowable expense. We've also, through ARTA, a contractor made available a tracker tool that some tribes use if they don't have an IT system as a case management tool and to support their data reporting.
Thanks, Andrew. Do we have any other new questions in the queue?
There are no raised hands at this time. Mark, do you have any calls in the queue? I'm sorry, please say again.
Yes, I have one. Hello, this is Lorraine Gouget, the Vice Chairwoman of the Array again. And I wanted to ask, the people that are in line for child care, they represent different programming. Kinship is one of them. And I wanted to ask, within the guidelines of that program, the way they formulated the kinship part as far as grandparents, aunties, uncles, that kind of along that line, some of our children have care given to them by others within the family. They could be extended family. Now, across Indian country, I know within our tribe, when you're talking your extended family, they are family. But it's not recognized with some of that wording or regulations at the level that those programs are being administered. And I'm not sure how we can change that or address that, because we have some of our people with that, whatever extended family that is, it could even be their namesake. Those who are, when they're given their Indian name, those who are seen in that light, their namesake. So that's a very special person in their life, and then they sometimes will take that care for them, and then they need that support to give them that care, because some of our families are in poverty or low income or whatever the case may be. So we were trying to meet that need, but yet we had to cut that funding source off to them because they didn't qualify and meet that.
Okay, so let us talk about that. That's a very important issue, and it has come up recently in our office, and I will call on Don Ramsberg in our operations division to talk about that, and she can explain how it isn't that money can't go to that group that you talk about, it's that they might have to have a little bit more training or meet a little higher bar to get it. So we can think about two things. We can talk about changing it, and we can also talk about in the short term, what can you do to get payment to those people, because it is possible to pay them. Dawn, are you on?
Hi, this is Dawn. Can folks hear me?
Yes.
Yep.
All right, great. I was not expecting that to work. So yeah, hi, this is Dawn, and as I'll build off of what Shannon was just saying. So CCDF, the regulations, actually the law defines who a relative caregiver is. So in terms of where our flexibility is, you know, that came to us through the law itself. But as Shannon was saying, it doesn't mean that people who fall outside of that definition of relative can't provide care. It just means that their pathway may look slightly different. So, you know, in terms of our flexibility, we can't define another close family member or an extended family member within that definition, but CCDF money is not limited only to those relatives. It could be someone else who's providing care in their home to that close family member. And so then depending on the requirements that have been set up for that, you know, kind of that home-based group that's not a relative, the bar may look similar, and it may be slightly higher, but there's some flexibility there. So definitely the program recognizes there's other family members that may provide the care, but in terms of that definition, you know, that's how the law defined a relative eligible provider. But there are definitely ways to have other, like, you don't have to be licensed to provide CCDF care, you know, that you can be someone that's providing care in either your home or the child's home, and there are pathways to be eligible. So does that help? Yeah.
Dawn, can you mention one or two examples of what might be required by someone who's not technically a family member, that's not all the way to what you'd ask of a licensed provider, but that they might have to do? And then also say who has the discretion to define what needs to be done if you're not the relative?
Yeah. So a couple of examples. So again, it might be in terms of training, where if you're a relative who falls in that definition, a lead agency, so the tribal lead agency, could choose to exempt a relative provider from specific training requirements, whereas if you weren't in that relative group, you may be subject to specific training, like health and safety requirements, you know, but there would be flexibility on how those requirements could be met and in terms of what kind of training. So it doesn't necessarily mean you have to go take a college course or even go to, you know, a 12-week class. You know, it could be a modified version or a scaled version that's appropriate. Appropriate meaning, you know, to health and safety, but not a multi-month, multi-year kind of class. So that's one example of how those requirements might vary, you know, where, as opposed to where perhaps to work in a center you have to have a certain level of coursework, you know, home-based providers, especially close family members, family, friend, and neighbor care is what some folks call it too. There might be just a simple course that's available. And then as far as who decides that, the tribal lead agency has the flexibility on making these decisions. And so, you know, I know that our technical assistance center offers a lot of support on helping tribal lead agencies kind of find the right tool to help with the need. So there is a lot of flexibility that exists, even if the requirements, you know, may be on a continuum, depending on where you fall in that provider definition.
I appreciate that, and I think some of these need to be addressed at the state level. However, I just wanted to add it to the discussion. But thank you.
Well, thank you for doing that. It's an important point. Did anything else new come up?
If there are any tribal leaders that wish to provide comment, please raise your hand if you're in the webinar. If you're on the phone, plus star pound to put you in the queue. Do we have any calls in the queue, Mark?
I had Silford on the line. I'm not sure if you had a comment.
Can you hear me?
Yes.
Yes, we can. Go ahead, please.
Okay, Montague, this is Silver Denver. I'm the Vice Chair of Bishop Paiute Tribe, also the Chair of Owens Valley Paiute Shoshone Board of Trustees in California. I have a question on CCDF. I know there's a lot of issues out here with the COVID going on, and child care is definitely needed, especially for a lot of our tribal members who are trying to return to work, but they have no child care, so it's a big issue. I know a lot of people that qualify for CCDF. It's a big concern. My question is regarding, I believe a gentleman earlier talked about construction funds. Could that include purchase of a modular, or could that go as far as improving a facility that needs upgrades? So that's my question. And I believe if we move forward with working with the CARES Act funds, tribal contributory monies, we would like to try to open up our own child care facility. So is that feasible?
Andrew, are you still on?
Yes, and Jim may also want to jump in. But yes, CCDF funds can be used for construction or renovation of a child care facility, including the purchase and installation of a modular unit. But the purchase of, it cannot be used for the purchase of facilities other than modular units. So hopefully that answers your question. We have a program instruction on our website that provides all the details around how to apply to use a portion of your funds for that purpose.
And our website is, well, we'll put it up there, acf.hhs.gov/OCC. Jim, do you want to add something?
Yes, I also wanted to let folks know that there is a separate application process for the construction request, and that tribes should consider a multi-year project if they're not working with a lot of money, so they can extend the time to actually getting their facility built and ready for use. Thank you.
And Shannon, this is Dawn, and I would just add one more piece to that. Not only is there a separate construction application, but we just issued the new one for FY20, and those applications are due July 1st. So if people are thinking about it, now is a time to, that you might be in a position to submit an application.
Right. Is there any difference between using the COVID money for this and using the regular CCDF money for this? For construction and renovation?
So tribes can actually use from both pots of money for the construction. They'll just need to identify it in their application.
If they're using the CARES Act funds, they have to establish a connection to COVID-19. So, for example, that there's a need for additional child care or different new child care settings that are able to more accommodate social distancing would be one rationale.
Okay, so
Yeah,
let me ask. Go ahead.
That was one of our concerns too, because, for example, we're doing a kind of a summer school right now, whereas before we were able to have a full set of students there. But now with the social distancing, we could only facilitate 8 kids, and you know, you have a lot of people that are in need, and we're just really concerned with that. But we're trying to figure out the best way to utilize all our funding sources to establish something that, and with the social distancing in mind.
Well, that sounds like a good reason to me. Jenny Gibb and our technical assistants, do you want to say anything about if they can't figure out what our rules are by looking directly at our website, where they would go for help?
Sure. Can you hear me?
Yes.
Great. I would suggest first that you get in touch. You can either go to our website, the Office of Child Care's website, which Shannon mentioned a link to just a couple minutes ago, and just look for the link on technical assistance there, and that will take you to our TA website. Or you could also contact our regional office. I think you said you were from, I wrote this down, Bishop Paiute Tribe in California. Is that right?
Yes.
Great. So I would suggest that you contact our Region 9 office in San Francisco, and I see on the list of who's on the call that at least a couple of them are on this call now, and talk with them to see if they have ideas about ways that they can support you, because our staff also provides direct technical assistance, or they can find a way to figure out what TA supports. They can talk with me, and we can figure out what types of TA supports perhaps we could help you with.
Okay, great. Thanks a lot.
You're very welcome.
Do you have any other new questions?
Not at this time. Ms. Gibb, is there a way that you could enter that phone number into the chat box for our record for the region technical assistance?
I'll put in some kind of a number for you. Just give me a couple minutes and I'll find the right one.
Right. If others are interested, then they need to call the regional office in their area. So all our regional office phone numbers are on the website that I posted in the chat line, in case someone's listening who is not in Region 9. Since there aren't other questions right now, one of the things that we're thinking about is what is the kind of technical assistance that you all think is needed, not just for your tribe, but for some of the tribes you know of or represent. We do spend a lot of money on technical assistance, and we do want to know that it meets your needs. And if there are things you're curious about that we're not addressing and that you think others would benefit from learning more about, this would be a good time to let us know.
If you have a comment from the webinar, please press the raise your hand button at the top middle of your screen. If you're on the call, please press *# to be put in a queue. Thank you. Mark, do we have any calls in the queue so far?
I believe Nigel has his hand up. His phone should be unmuted, and unless it's muted on his end.
Hi, this is Nigel. Can you hear me?
Yes, we can.
Yes.
Go ahead, sir.
Thank you very much. Once again, my name is Nigel Lawrence, the Secretary of the Suquamish Tribal Council, as well as Director for our tribe's Reinforcement Boucher Early Learning Center. Thanks everybody again for putting this together, for all of you that called in, and for all of the amazing comments. I'm agreeing with everything so far, so please make sure the notes reflect that. Every question I'm hearing from tribal leaders and representatives, I'm agreeing with all of them. So add another dot or asterisk or tally mark or whatever you do. My question is, well, a comment and a question. I'm in Washington State, or really Washington State surrounds me because we were here first, right?
Right.
Sarah Stafford is our person, and Paul Noski is our other person here in Washington, and they are amazing. They're awesome. They do great work. And I've also been working with Jessica Farley as the TNTA person, and she's also amazing. So, my hands go up to them as, doing amazing, great work. And I've talked to Sarah a little bit about this question. Office of Child Care has us in Region 10 here in Washington, here, around the area of Washington. And Head Start has us in Region 11. That's all natives are in Region 11. OCC is different. We are in our location base. And I have never understood the difference there. I don't know. I do a little bit of both, and I see it. I don't really know the whole list of pros and cons is I guess what I'm getting at. And so maybe people can reach out to me on the side about their experiences. I do feel like Washington State has a whole lot of tribes. I mean, we're not like some tribes that take up 4 states. We have 29 federally recognized tribes in Washington. And I feel like that's a lot of work for Sarah and Paul to be doing on their own. And I don't know if I'm advocating for us to start our own region like Head Start does, or if I'm asking for more people to be over here doing stuff. But again, every time I ask Sarah a question, she responds immediately and knows a ton of stuff off her head. So again, they're amazing. They're awesome.
Yeah, Shannon, I'll give you a couple of thoughts about that. We don't have a Region 11. We just have 10 regions, and we have in each region the tribes and the states together, and that's in part because a lot of the work that needs to be done between the tribes and the states, it needs to be coordinated, that not all tribes are separate in every respect from the state. Sometimes the programs are intertwined a little bit, and so that's helpful. They also have a migrant region. We don't have that either. Part of it's because Head Start, the money goes from the federal government right to the local Head Start provider, whereas with child care, the money goes from the federal government to a state or tribe, and then the states and tribes work out those dollars for those jurisdictions, and it just has never seemed like something we should do. What we'd really like to do is try to improve the coordination between the states and the tribes in those regions, and we'd also like Paul to have more staff. And did he pay you to do this? I mean, we know he's overwhelmed, and he's just lost one of his people, got promoted to head up our region in Region 3, and so he's going to be down even more for a couple of weeks. But is there, I guess I would like to know from you, what do you see as the benefit of having a region where all the tribes are together versus using the same office that works with the states? Just because we haven't never thought about it before.
Again, I still feel like I'm new to this. This is my 5th year being here. I haven't, worked my way up from a teacher to be here like a lot of other people. So I feel like I don't know enough to answer that very well. I know that in Head Start, I feel my first understanding was Region 11 can be all tribally specific, and that's awesome. That, there's all this support for language and culture revitalization and all of the more understanding that goes in there. And over on CCDF side, OCC, that we are in Region 10, I don't know about the other 28 tribes in the state, but we have had or the rest of the country, we've had a combative relationship with Washington State. I mean, we're the ones, right, the bold decision, people would be shooting at our people trying to fish and dig clams, and we had to ask the federal Justice Department to come in and take the state of Washington to court, and that's been a huge thing for the last 40, 50 years. We're getting better. Our relationship with the state is better, but I just don't like pass through anything going through the state to get to us, because our treaty says we have a relationship with the federal government, and the Constitution says, Congress has this, the Indian Commerce Clause to regulate commerce among the Indian. It doesn't say the states can do that. And so I get frustrated when, I'm asked to go work with the state on things. But again, I know that is why there's a Sarah Stafford there, that a tribal person was hired to do that, and how awesome she is. So I just feel like a little bit more focused, I don't know, a little more focus of tribal specific curriculum, I don't know, everything that comes with a Region 11. But again, but the other side of that is every region should be better educated about tribal stuff. So that's a good reason to say with the current system that every region should learn more about tribal sovereignty and do all of that. But, you know, on the Head Start side, they're not. The other 10 regions don't want to help tribes. They don't want to do that because, oh, that's a Region 11 problem. We don't have to worry about it. So, you know, that's a good reason to do it the way. Right?
Yeah, pros and cons. Yeah, but it's a very interesting question, and I'm glad you brought it up, and I think it'll give us some food for thought. And thank you. Very interesting. Jenny, do you want to say something about the Tribal TA Center and the things that we do that are directly for the tribe? Luckily, we do send the money directly to you, but I know what you mean. There are certain things that you need to interact with the state on that probably can be combative. So we're aware of that. But Jenny, do you want to say anything?
Sure, Shannon. Actually, that was good timing because I was just typing in, first I typed in a link to our technical assistance website for OCC, and then even though you can get to our tribal center from that link, I typed the link in specifically for that. Well, so what I wanted to let people know is that we have a tribal center for child, we call it a National Center on Tribal Early Childhood Development, and they provide technical assistance generally on all the requirements in our block grant. So whether it's working with your subsidy program, working on professional development, on quality improvements, or if you want to work on language and culture, which would be a quality improvement expense, they help with all of those things. We have real expertise in that center. We're really pleased with it. But we don't just have that center. We have about 7 technical assistance centers and more where we've jointly combined with Head Start on a few topics such as development, teaching, and learning. That center does a lot of your work around coaching and mentoring and many other things. And then parent, family, and community engagement, that's another center that we work with Head Start on. And then our third center we work with them on is health and safety, or it's the National Center on Health and Wellness. But within child care specifically, our requirements are different from Head Start because, number one, and this gets, I think, to part of the issues of being why Shannon was talking about why Head Start has Region 11 that Todd manages, and that's in central office, and why child care has regional offices, but our staff that work on tribal issues are housed in the regional office. Well, we have a block grant. Head Start has a discretionary grant, and Head Start has performance standards. We have regulations, but we have a generally pretty flexible block grant. And we have some state tribal coordination requirements that were increased when Congress reauthorized our program in 2014. So we see the way that our system works, at least on the child care side, working with tribes from the regional office. And again, we work very closely within central office in DC and our 10 regional offices around the country. But we have a lot of TA. Not only do our staff provide direct TA, which I was mentioning before, we have this array of technical assistance centers that some of them have staff now that works specifically on tribal issues. For instance, with our National Center on Child Care Subsidy Accountability, Innovation and Accountability, that's basically program integrity and subsidy program. We had them, we put extra money in their contract, or we added money to their contract last year or the year before to hire someone who works specifically on background checks for tribes. And we already have a person in that center who is working on subsidy issues for tribes. So we have supports here and there within our centers that are helping tribes, and we're going to continue working on that to make sure that you all have the support you need to help you figure out the pieces of the block grant. Does anyone have any questions about that? Oh, one thing I want to add is that our technical assistance is paid for out of our block grant. So it's free. It's a free service to you all. States, territories, and tribes can use their some of their funding they can purchase their own technical assistance or supports, but the TA centers that we have, our technical assistance centers, all the specialists and subject matter experts, and we have so many subject matter experts who actually were either state child care administrators, tribal child care administrators, headed licensing programs, ran the Quality Initiatives part or QRAS part of the state, mainly states on that one, except I know California has a lot going on with QRAS. And they're all paid with federal dollars. So any technical assistance that is provided from the Office of Child Care is free. And I hope everyone will remember that and know that you can go to our websites, you can contact your regional offices, and participate in any webinars or other activities that we have that we send out and designed for you with your input. We hope you'll take advantage of because, again, they're free. Thank you very much.
Thank you, Director.
Go ahead. Please go ahead.
I'm sorry, I'm just being mindful of the time, and so wanted to make sure that we move on with the agenda. Is this who is speaking at this time?
Okay. We can close. We can wrap up right now. We're finished.
Okay, thank you so much. Thank you, Director, for all of your words, and thanks for everyone who participated in that and gave testimony. We will now begin the Thank you. We will now begin the consultation session with the Administration for Native Americans, Commissioner Hovland. I turn things over to you.
All right, thank you, Mr. Chairman. This portion is going to be slightly different as it will be broken down into 3 distinct topic areas. We're going to hear remarks for one topic at a time, open the floor for your comments, and then move on to the next topic. This is specific to the Administration for Native Americans, where I'm Commissioner, and I'm really asking for input on 3 areas today. And of course, you'll need to have time to think about some of these items, and we'd love to hear from you during the 60-day comment period. So the first policy discussion I want to talk to you about, and we only have 15 minutes for each discussion. I also want to acknowledge that I have with me today the Administration for Native Americans Director of the Division of Program Operations, Mia Strickland. She's going to be available to answer questions on a couple of these subject matter areas. She's an expert in this, been with ANA for several years. It's the person that is behind getting the funding opportunities created, the language in it approved. It's a huge process, and she does amazing work, her and her team. So she is available to answer questions. Our first topic I want to talk about is protecting our tribal intellectual property. ANA is looking for tribal input on this issue of protecting the intellectual property of Native American languages and cultural resources developed under an ANA grant, as well as recommendations on safeguards for future protection. ANA believes that Native American communities do best when they are able to determine their own processes and priorities. This is in keeping with the federal policy of self-determination for Indian tribes. ANA promotes community-driven projects to encourage tribes to build local solutions versus contracting out to others. Community-driven projects help to build local capacity, which is vital to long-term sustainability. ANA hosted a workshop on intellectual property at the ACF annual Native American grantee meeting that was held in Crystal City, Virginia in February, and we will continue to offer this workshop annually. ANA could do one or more of the following options to address the issue of protecting our native languages, intellectual property that are developed with federal funds under ANA. Option 1 is ANA's training and technical assistance, which we provide or mandated by Congress to provide free training and technical assistance to our grantees. And we could develop resources and training to help grantees support the safeguarding of language and cultural intellectual property. A toolkit specifically designed to address tribes working with consultants could include background information on intellectual property and common issues to spot in contracts. Additionally, the It could emphasize the importance of retaining rights over language tools developed. And also, these are options. It doesn't have to be one or the other, but we can also consider adding language to the funding opportunity announcements around this issue. We've been looking into this for a while and researching it. That language could read something like this. ANA offers educational material regarding intellectual property to all grantees via technical assistance. Grantees are encouraged to educate themselves on tribal rights and ownership to language materials, history, music and dance, ceremony, and other forms of knowledge and cultural practices that originate from a tribal nation. Moreover, grantees are encouraged to learn how such rights may be transferred via contracting with third parties that develop language tools. Another option is copyright condition to ANA funding policy. ANA could require grantees have contractors or partners transfer any intellectual property rights to the material over to the respective tribe or tribes that the project is intended to benefit. This will ensure that the tribes are in control over how the language and cultural materials are disseminated during and after the funding period is over. These options are not exclusive. ANA could implement either of these recommendations that I read to you, but we're also open to suggestions. It's imperative that I hear your feedback. These are concerns that I've witnessed and heard about as far as our languages, wanting to make sure that they are, the intellectual property remains with the tribe. I just want to make sure that as we're talking about some of these conditions, like the copyright condition, I want to be very transparent. I do not like the federal government to be paternalistic. I certainly do not want to have a leadership of paternalism. So considering the copyright condition, it could be looked at as ANA is mandating our tribes to include this in their projects and the appearance of paternalism. And so I want you to consider that as we look at should we make these changes or implement them to protect intellectual property rights. So at this time, that is what I want to put out there, what I just shared with you. Happy to answer questions, but also to get your feedback on this issue of intellectual property.
At this time, if there are any tribal leaders that wish to provide input or comment, you can select the raise your hand icon in the top center of your screen. For those on the call or on the phone, you can press * pound to be put into the queue. Thank you.
I see where Sherry Goodwin has mentioned, so you're saying we own the intellectual property. I'm saying, yes, the tribe would own it, the intellectual property that was developed under the ANA grant funded project. I'm sorry.
I have Vance on the line. Vanessa, you can go, please.
Hi, Vanessa. Can you, if you're speaking, we're not able to hear you.
I've enabled your microphone so you can speak, Vanessa.
Not able to hear you, Vanessa, if you're speaking. Vanessa, that's how she can unmute. There might be an icon on your, well, she's on her phone.
That's the operator. Please hit * pound again. I'll unmute your line for you.
Can you hear me now?
Yes, we can. Thank you.
Okay, thank you very much. My name is Vanessa Vance,
and I'm the treasurer for the Wichita and affiliated tribes and serve on the ACF Advisory Board. And this is an issue that we've been concerned with our tribe because we have lost our last fluent speaker. And we have a linguist who has collected information on our language for over 50 years. And we do not have access to this information. It's very concerning. So if we were to copyright our language, how would that impact this collector?
So I'm going to be honest, I'm not certain because I'm talking about specific to what is developed under the Administration for Native American grant under our
Okay,
funding.
we are applying for a language grant this go round. So are you suggesting that we include something on attempting to copyright what we produce, or is this going to be a requirement for A&A grantees?
Well, this is something that we currently have not implemented or we do not have any language requiring this. And we're asking if it's something that the tribes would like us to consider at this time. Mia, feel free if you would like to speak a little bit about this.
Thanks, Commissioner. Hi, everyone. Vanessa, we are trying to protect the ANA grantees so that any materials developed under an ANA native language grant any copyrights would be kept with the entity that we funded and not with any third-party consultant that they may have hired to do the work. Hopefully that clarifies.
Thank you.
So at this time, though, the tribe can already make that decision. Correct, Mia?
That's correct. I think the concern is we're not sure if tribes are putting the provisions in their contract.
You're breaking in and out, Mia. Okay, we're not able to hear Mia, but the tribes can put that in the contract, but it's not always really clear when there's a third party that has been hired, and that's why we're trying to get education to our tribes at grantee meetings about the importance of having this information in your contract. What if a tribe receives an ANA grant, you can write that in there already and practice that. But not everybody or organizations know that this could be an issue if it's not addressed up front and there's a third party that has been hired to help develop it, the language. And so we're asking, one, we want to educate on it. We'll continue to do that. We're committed to do so. But two, not everybody will receive that training, or they might receive it afterwards. Should we have this language in our funding opportunities? And if so, then it would mandate tribes to do that with the appearance of paternalism while trying to protect the native languages. Mia, I'm sorry, you have a bad connection. We weren't able to hear most of what you said. Vanessa, did that help?
Yes, it does. We have a lot of discussion to do at our tribe.
Okay, thank you. And it's something to think about because it is a big decision. So any other comments, suggestions?
We do have one call from Gil.
Yes, I just want to make a recommendation that I know NCAI does a lot of work in this area. So you might want to contact them, especially Joe Garcia. And I know because of our some of the work that we're doing also, we want to make sure that we comply with the tribe's wishes about how much information they want to divulge. So I think NCAI might be an area to go to get more information on this.
Thank you. I really appreciate that. We will reach out.
We have no raised hands at this time. If anybody would like to make comment, please. Oh, there's Cherie Goodwin. Sherry Goodman, you're good to go. Your line has been unmuted.
Good afternoon.
Please state your
Good afternoon.
name and tribal affiliation, please, for the record.
Good afternoon, Sherry Goodwin, Red Lake Nation, Red Lake, Minnesota.
Thank you. Go right ahead with your comments, please.
Okay, my comment is I'm really glad that you are thinking about this, the way the funding goes to the tribes because for this intellectual property, because right now we have contracts with like a Department of Human Services for Minnesota, and we're debating them because they're saying they own the intellectual property. It's like, no, we did the work here on the homelands. We might have used them funds, but it's our research and our property. So I'm really glad that the Administration for Children and Families is doing this because then I'm hoping that this trickles down to tribes, I meant to the state, so there'll be some kind of guidance to them, so then we can own our property, our intellectual property. For instance, right, strategic plans, policy and procedures with our Anishinaabe worldview, licensing standards, right, because our tribal nations are different than states. So I guess my comment is I'm just really glad that you guys are onto this and that hopefully it trickles down to the states.
Thank you. I appreciate that. And we understand that our language has a spiritual component too. And so definitely appreciate that. And if you want to put something in writing, that would be helpful too for the record. Thank you. Any other comments on this? And I know we have a few more topics to get through in this session.
We're going ahead with topic number 2. If anybody has comments or input, please select the raise your hand icon in the middle top of your screen or press star pound to be put into the queue. Thank you.
Okay, thank you. We'll go ahead and move on to the next topic. I want to talk about the non-federal share waiver regulations specific to ANA funded projects. And this has been brought up due to the COVID-19 pandemic. We felt at ANA we needed to discuss the current federal match regulations. And in ANA, we understand that lower capacity tribes and growing organizations may not have the ability to meet the 20% match requirement. So we've already had that understanding prior to COVID-19. And for these applicants, we offer a non-federal share waiver, but it's specific to the Social and Economic Development Strategies funding, our SEDS funding, and then our Environmental Regulatory Enhancement programs only. Does not include our native language programs. I'm going to talk about that separately in a moment. So for our SEDS and our Environmental Regulatory Enhancement, we do have a federal match waiver for the 20% requirement, but it can only be issued during the beginning of the budget period if the grantee meets the financial criteria. So it's not necessarily an emergency waiver. And unfortunately, ANA does not have the authority to issue emergency waivers. So if it's not the beginning of the budget period, which is when the COVID pandemic struck, was during our budget was already in process, the budget was already approved for our grantees, there was implementation of it, and we were unable to offer waivers because we didn't have the regulations. So we looked at other ACF programs who have emergency non-federal share waivers, such as the Office of Child Support Enforcement, and talked and looked at what they have for their waiver. So I would like to hear your input on, with the COVID-19 and the importance of ANA looking at our regulations and seeing if we need to try to make an adjustment to this permanently for emergencies. It is in kind. It doesn't have to be a cash match. It can be in kind, but we saw with the COVID-19 where, you know, programs were shut down, people weren't able to do the volunteer work, to be able to utilize buildings because everything was shut down. So I just wanted to bring that up to you as part of our consultation, if that's something that you feel that ANA should prioritize and look at to maybe implement some kind of a waiver like the Office of Child Support Enforcement has. We would look again at the circumstances. It'd be case-by-case situation. So there's that. And then we also want to talk about the Native American Language Preservation and Maintenance funding and the Esther Martinez immersion funding. These are our two language programs that we have. Neither of these are eligible for a non-federal share waiver, and that is due to our authorizing legislation. So that is something that ANA does not have the authority to change. That would have to be changed through Congress. We understand that we cannot lobby for this change, but we would like to use this opportunity to hear from you to see if that is something that if I'm asked by Congress that I can say that I've sought consultation, I've asked tribes about it, and they feel that either it's important at this time or not necessarily important. So two issues under this, but both are about a federal share waiver. I would like to ask if any tribal leaders wish to make a comment at this time.
We have William Micklin on the line. Go ahead, please.
Hi, can you hear me?
Yes, we can, sir. Go ahead, please.
Thank you. Yeah, Will Micklin, Vice President, Executive Council, Tlingit Indian Tribes of Alaska. So, yeah, this is an important area of concern for us and a priority concern. The burden upon this tribe, as well as other tribes, to fund a non-federal share in such a high percentage as 20%, and other programs can be lower or even some up to 50%. But for the 20% non-federal matching share is a burden on and an impediment on our providing critical and essential services to our tribal citizens. And I'll speak about this in two contexts. One is in the COVID-19 pandemic. So as I mentioned in my earlier remarks, we have a portfolio of investments that we rely upon that income for providing the shortfall, which by that, using that term loosely, meaning to fund the non-federal share for many of our programs. And the losses in the market mean that if we derive income by selling shares, then we're realizing losses. And those are extensive losses, and that would be realizing a loss over many years, and it takes many, many more positive returns to make up for realized losses. So that we provide shares for many programs, and for instance, with TANF, in Alaska, we're bound by the comparability requirements that limit the monthly benefits for TANF households to be the same as the state of Alaska. State of Alaska benefits have not changed for 27 years. The federal TANF hasn't changed since 1996. We have share burdens in about any program. I won't mention all of them, but all of them require a significant burden on the tribe funding that non-federal share. So my concern is that how it is that we demonstrate that we lack available resources. I mean, this is a persistent problem that we've, in my 30 years in tribal affairs, we've mentioned the same burden and inequity on tribes, and if it hasn't been convincing to now, I don't know how much more convincing we can be. It continues to be a burden. How the regulation would would provide what kind of requirement there is to demonstrate that we lack available resources. It is certainly, we think, evident in the COVID-19 pandemic and the impact on our financial wherewithal. And on an ongoing basis, even after the pandemic abates, it will continue to be a burden on the tribe's finances. So the demonstration that how we lack the available resources is a important point in how that is implemented, and the demonstration of reasonable efforts to obtain cash or in-kind contributions. No, we have limited cash, as I mentioned, and we have a finite pool of in-kind contributions, and we spread that over every program, since every program seems to have its requirement for non-federal share, and we have no more left. And the COVID pandemic has shrunk that pool of both cash and in-kind contributions. So our ability to create more of that and apply more of it to the increasing need is incredibly constrained and just not practical or feasible. So the further limitation that this be only for the immediate budget period is also means that we'd have to go through this exercise on a continuing basis, and the implication of this regulation is that this is an exceptional circumstances for a waiver not readily granted, and that we could not rely upon this for continued budget periods. So all of these speaks to the incredible need for us to resolve this issue of federal need. And it's not just the programs that we service, it is the secondary and tertiary implications, particularly in this COVID-19 pandemic, where we have domestic violence on the increase. We have mental health needs on the increase. We have limited foods and supplies available in our village communities, even for those that want it. And for those that rely upon employment and seasonal employment that is impacted by the pandemic, there's even greater cause for concern amongst our communities. So we have diminished resources in each of these areas. Our Family Violence Services Program used to be funded $209,000. We've this year only received $45,000. It's been significantly reduced over the past 3 years. So all of this says that our resources are diminishing. Our ability to leverage those resources with our own treasury and a level of effort from employees is diminished, and that this attention to our mechanism for providing relief from the non-federal share needs to recognize the extent of the need and the impacts on our communities by failing to provide that relief where it is justified. And again, we have written comments that can parse through the justifications, but these are similar justifications to the urgent expression of need we've made for these many years. And the COVID-19 pandemic has only increased that urgency. So the regulation needs to be flexible. It needs to be permissive to the application, which should really seek to benefit and approve the application from tribes, and not seek to constrain it by its every criteria and evaluation mechanism. So this is an incredibly urgent need, and I'm hoping that we can seek some sort of consultation so that we can make this mechanism through the CFR more readily responsive to the need that not just I, but most every tribe, particularly rural and remote tribes who have citizens in great need, are seeking relief. So thank you again for the opportunity.
Thank you, and I appreciate that. And I just want to mention also that if the goal, to meet the entire goal of the project was, let's say it was $1,000 and 800 of it was what the federal government was going to fund, and then there's the 20%, but that 20% was really needed, required to complete and meet those goals. So say we offer this 20% waiver, and then we need to consider how will that grantee be able to reach their goal yet? If there's a waiver, which is definitely needed, but is it going to stop the project from being able to complete itself, to be completed? So that's another area that we want to think about. And that's where, when this happened with the COVID, we talked about, there's definitely need for a waiver, but we also want to see that this investment in this project, that it's able to be complete and to meet its goal. So keeping that in mind also. And in addition to that, if you know of agencies, whether they're ACF or another federal agency that has a waiver process that you feel is really stellar and easy and a great process that we should look at, please let us know about that also. Are there any others? I see there are a couple hands up.
Mark, we do have one in the queue.
Okay, yes, let me go ahead and bring that person up.
In the order that they were responding.
This is Vanessa Vance again with the Wichita Tribe, Wichita affiliated tribes. When you're talking about the waiver, you made some statement about it being done in the first budget period. Are you saying that they need to, after their funding, they can request the waiver, or does the waiver need to be requested before submitting the application?
The waiver needs to be submitted at the time of the application. And then if there's an ANA grantee and it's time for them to request like a no-cost continuation at the beginning of the next budget year, it can be negotiated at that time. But say then their budget's been approved and they're a couple months into implementing that year's project, at that time we're not able to issue a waiver. Mia, if you have audio yet, just want to make sure I'm correct on that.
That is correct, Commissioner. Can you hear me?
Loud and clear, thank you.
Okay, thank you.
I have one other question concerning that. Since you say that if you had a current program, you could request a waiver for the next year. Does, and this is kind of a technical thing, but does the growing organizations and the SIDS have the same CDFI number?
Yes, they do. Yes, that's correct.
So if you applied for one, you can't apply for the other?
You can apply for both, but you will only be able to receive one grant under that CDFA number.
Thank you.
You're welcome. Thank you.
We do have one with the raised hand. Lisa Reiger. Go ahead, please. Ms. Reiger, your phone has been unmuted. You're good to go.
All right, my microphone's on now. To follow on and to reinforce what Mr. Micklin described in so many different circumstances at ACF and across HHS, the need for a non-federal match in communities where there is little resource, if any, to generate non-federal dollars is a significant barrier to providing effective services to our people. And in particular, because it comes from the local and state government model and they have a tax base, it really doesn't apply adequately in Native communities. So we really support making waivers as flexible and simple as possible. In answer to your question, Commissioner Hovland, absolutely. There should be an emergency provision that's made permanent to the extent that any and all waivers of federal match could be made permanent and maybe by program as opposed to by individual grant. That would be a really important and effective response to this ongoing problem. I know that you both know that the Secretary's Tribal Advisory Committee has been recommending this for probably as long as it's been in existence. And so we really encourage the suggestion that there be an emergency provision that the match be removed where at all possible, and I think that's it. So.
Always, I appreciate your comments and input. Thank you. Again, I want us to keep in mind on reaching the goal if we were to waive that 20%. How do we ensure that the grant can still be successful if it was the entire budget 100% required to make it successful, and there is that 20% waiver that has been implemented?
So I have a kind of a radical idea spoken from a very non-bureaucratic perspective, and it may not work at all under any of the financial accounting rules in the federal government, but I mean, if it could be possible to remove the non-federal part of the match so that if tribes and tribal organizations had resources they could allocate that might be federal in nature but could help get the project completed, that could become a possibility. I don't know if that's something others would want or even if it's a remotely possible suggestion, but it's one thought that we have.
Thank you. And quite honestly, I think this can blend well into the next topic as we talk about the Native American Programs Act, which is the authorizing legislation that created the Administration for Native Americans. So administratively, we can look at an emergency waiver for those two programs, Social and Economic Development Strategies and the Environmental Regulatory. However, for the Native Language Programs, we do not have that authority. So the Native American Program, or the NAPA Native American Programs Act, has been expired. We've been, working under it. It doesn't stop the work that we do. It has had some amendments to it and reauthorization and additions into it. For example, let me talk about some of those changes that have happened. Actually, and it's our 45th year since ANA was created under the Native American Programs Act. In 1985, the addition of the Native Hawaiian Revolving Loan Fund was established, which was, I think, a 3 to 5 year demonstration project back in 1985 that still remains under NAPA and has never been removed. This demonstration project, and the Native American language grants were added to authorization in 1992, and the S. Martinez Native American Preservation Language Act was first authorized in 2006 and added under NAPA, and recently it was reauthorized in December of 2019, and many of you on the phone were instrumental in getting the S. Martinez Native Americans Preservation Act reauthorized with some very positive changes. It's extended up to 5 years from a 3-year grant up to 5 years. It reduced the classroom size, making more or smaller communities eligible for it. So thank you for your advocacy. So that portion under NAPA was reauthorized in December of 2009 and signed into law, but NAPA overall has not been reauthorized. So that is where significant changes like what we're talking about today, where Congress says, ANA, this is what your waivers are, this is what they'll do, this is what we're giving you authority to, so that we can make some changes based on consultation on looking at emergency waivers for those two programs administratively. but there's things that we can't do that we've talked about. So in addition, I want to hear from you on other items, and like I said, if you aren't familiar with the Native American Programs Act, please take time to look at the law currently, and if you want to think about ANA, the Administration for Native Americans, and what you'd like to see Congress do with ANA, changes, additions, what have you. I did see one of the comments talking about Native language grants not being competitive, but being more of a formula grant. That's something that Congress would have to do. So that would be where you would work with Congress through reauthorizing NAPA. So at this time, I'm going to go ahead and ask operator if there are any tribal leaders that want to make a comment that can continue on from what we were just talking about and flow into this reauthorization.
Mark has one call in queue.
Go ahead, Kilford, your line's unmuted.
Oh, okay. Kilford Denver, Vice Chair Bishop Paiute Tribe, Chairman Om Sali Paiute Shoshone Board of Trustees. Gene, I was trying to comment on the previous one with the federal share. Anyway, on the Om Sali Board of Trustees side, as chairman, we have the Om Sali Career Development Center, which under that we have our language program that in 7 California counties we service 12 tribes, and our language program gets out to all those communities. We're currently teaching about 8 languages, also including Navajo and Yaqui that are in the urban areas as part of our program language. And we're looking at submitting an application for an ANA language grant. But my question, we're a tribal organization on this side, and we only have restricted funds. We have no unrestricted funds. We don't have a tax base. We don't have monies coming in to implement as part of the federal share. Are we allowed to do in-kind services? For example, if a tribe was to donate facilities for the operation of improving our language services. Also, we have like a grant writer. She is willing to donate all her time to submit the grant. Are these allowable costs that could go towards that federal share?
Mia, I'm going to have you respond, please.
Sure. Can you hear me?
Yeah.
Okay, great. Yes, ANA does allow in-kind services such as property, rent for where the program or the projects might be implemented, or even staff hours. Sometimes they want to use federal dollars for a portion of the hours, and then maybe also a few hours for the non-federal share. It's very flexible what in-kind services could provide if you're using a videographer or your grant writer, for example, and they're contributing towards the project's implementation. That could be utilized as in-kind as well.
Okay, great. That was the question I was wondering about, because again, each tribe's looking at doing some type of in-kind, since we're in a big service area, and it's including some of those other tribes.
Right, and you're welcome.
Do we have time for one more call? I think Mark had one call in the queue. It's 5:29.
Caller, if you're speaking, we can't hear you. Operator, are you there?
Yes, I'm going to go ahead and put them in the queue, put them on the line. Go ahead, your phone's unmuted now.
Hello, this is Lorraine Gouze, again, the Vice Chairwoman of the Curé. And I've been listening to the discussion here, and I do agree, Judy, when it comes to that 20%, how that waiver, the impact it will have on the programming. So you kind of catch-22 here, because the tribes are having difficulty because we do not have that revenue coming in that we normally have, and to be able to do certain things when it comes to the match and coming, to help with that 20% there. But again, the programs that do suffer. I just met earlier today with one of our programs, and we're trying to figure out how the best way to do this so that we can still keep our programs functioning and doing what it's meant to do. So I can hear that. But I do want to keep doing what we can for our language programming. At LCO here, we have our language immersion program, so we've been trying to save our language. Like one of the other leaders had said within their tribe, they're down now to the last one or wherever they're at, and they're going to lose their language. So whatever means we have here to keep engaged and keep learning, I think it is important that we are able to keep those resources, the things that we've developed ourselves, to keep in place with our people, to keep adding to that, to keep learning, and to keep that language alive, and to keep moving forward with that. So, but I just wanted to make a couple quick comments there because, again, it is catch-22 with that 20%. So, but whatever we can do. Thank you.
Thank you, Vice Chairwoman. Appreciate that.
Commissioner, before we move on to the missing and murdered Native Americans, Julie, is there a list of allowable in-kind costs?
Nia?
Hi, thank you for that question. I do not have a list, or we don't have a list of what's allowable, but in general, anything that the grant could pay for is what would be allowable. Anything the federal dollars could pay for is what the in-kind could be allowable for. And I just wanted to clarify the previous gentleman's question about using a grant writer. Pre-application costs are not allowable to be charged to the federal grant. So any cost to produce a grant application cannot be charged to the grant. However, if that individual was involved in the project's implementation once it was funded, that service could be charged as non-federal share to the grant. And in terms of identifying non-federal share, I wanted to mention that ANA has training and technical assistance centers in 4 regions, including the Eastern region, the Western region, Alaska, and the Pacific Basin. And they're very talented individuals, and they can also work with applicants to help them identify sources of non-federal share.
If anyone has any additional comments, you can use the chat box as well as send in additional testimony in writing for testimony. We will now move into the discussion on missing and murdered Native Americans led by Commissioner Hovland. Commissioner, go ahead, Commissioner.
All right, thank you. And saving this for the end of the day, something to think about, something that's heavy on our hearts also. As many of you are aware, the Administration for Children and Families is working on a framework on missing and murdered Native Americans. And the purpose of the framework is to align with our ACF activities in a way that drives the agency's program to better address the factors that contribute to Native women, men, girls, and our boys disappearing or being murdered. You are familiar with some of our programs that we've heard about today and more tomorrow, looking at our high-risk vulnerable populations within ACF that we provide services for, those that would be at risk that could be either end up going missing or being murdered, heaven forbid. But it's a reality that we need to continue to talk about and keep the momentum on to address this. These factors are underlying contributors to the social determinants of health and include all forms of violence. child abuse and neglect, domestic violence, stalking, psychological aggression. In addition to that, economic instability, poverty, lack of shelter and housing, lack of positive relationships and connectedness, lack of access to early childhood education programs, all of which we've talked about today, because ACF again has programs that provide services to our populations that have these underlying factors and social determinants of health. Other factors include trauma and cultural identity, from colonization, historical trauma. It's just carried over, and we're at a point now where we have to have these conversations. We have the White House that has made this a priority, Congress, our federal programs. Your voices have been heard. Thank you for your years of advocacy on behalf of our relatives that have been missing, those that have been murdered and haven't had justice. I want to thank you all. We have a lot of work to do, and it's something that will have to continue for generations. Importantly, these factors are amenable to prevention and other interventions supported by ACF, and simply put, ACF programs have a direct link and are intended to address these factors. Collectively, we know that ACF programs working with tribes and communities can make a difference in the lives of our vulnerable Native relatives and in our communities. This ACF framework, which we hope to have available, we had hoped to in May, but because of COVID, we've had to focus on responses. But in the next few months, this framework will provide resources and tools to support prevention, intervention, and healing for victims, families, and communities affected by MMNA. So in partnership with the National Council of Urban Indian Health, ACF obtained direct feedback from urban Indian programs across the nation about contributors to Native people disappearing or being murdered. As you know, many of our relatives are in urban settings when they've gone missing or murdered. So we want to make sure when we address this, we're talking about our Native peoples in our communities, but also in urban settings. So we also received input from Native American state legislators, several of whom have championed legislation in their states to help combat this issue. We've also received input from ACF Tribal Advisory Committee, many of which have been on the call today, and I have so much respect for them, our TAC members, and we've also received input from ACF program offices. The ACF leadership want to make a difference and help any way that they can in regards to our missing and murdered relatives. We've assessed literature and created an ANA internal think tank with our staff, and one of the staff members completed a data mining on ACF consultation summaries spanning a period of 9 years. The consultation sessions used in the data mining were like this one today and contributed to the assessment of common themes over time. This has been a common theme over time. It's been a common theme since I've been in this position, asking to make this a priority. And so it has been made a priority. So in addition to my role as Deputy Assistant Secretary and Commissioner, I am a member of the Presidential Task Force on Missing and Murdered American Indians and Alaska Natives, also known as Operation Lady Justice, and we are connecting health and human services with law enforcement and justice. This came from your input again, saying it's important that we have law enforcement, that we have investigations, that we have our cold cases looked at, but this is also health and human services. We need health and human services to help preventing more of our relatives from going missing, to help our communities heal from the devastation of this. So again, this has happened out of your advocacy and your input. So consultation does matter, and your voices definitely make a difference. The task force recently held 4 virtual listening sessions. These sessions were open to tribal leaders and others. And while we gather input from across Indian country, the prevailing questions we have are, 1, how do we keep the momentum going in communities in the face of pandemics like COVID-19? And while we work to make program policy and other changes, how we've heard reports of domestic violence across the nation increasing during COVID-19 because of the stressors. How do we make sure that we keep the momentum and the services available? And then also, what are critical communication and outreach strategies to reach and connect with local communities? The task force, I attended several HHS regional consultations last year and held discussions on this topic. Other challenges we hear is lack of data, and we heard about this earlier. Challenges in identifying race were commonly brought up as concerns. The interconnection of human trafficking and murdered and missing Native American was also at the top of the discussion. Tomorrow, we will have Catherine Chan. I have so much admiration and respect for her. She is the director of the Office on Trafficking in Persons. She will discuss ACF's anti-human trafficking efforts with you, so I hope you're able to join that discussion tomorrow. So back to today, I need to hear from you on how ACF can be effective in addressing this with a goal of prevention. Your input will contribute to developing a sound strategy and executing an education and an outreach campaign for communities that are most affected by crime against Native Americans. So I'm looking forward to your recommendations and comments. Chairman Sullivan, I'm going to hand it over to you.
Thank you. Operator, we're ready for any tribal leadership or any participants that would like to make comments at this time. Please remember to state your name, title, and tribal affiliation for the record before making your comment.
Thank you. I'm about to send somebody now. Go ahead, your line's unmuted.
This is Vanessa Vance, Treasurer of the Wichita Affiliated Tribes. I'm concerned about this funding because, at least what I've seen in Oklahoma, most of the people that are addressing these issues are grassroots organizations, and most of them are not organized as a 501c3 or any other mechanism to receive funding through. And I don't know too many tribes that have taken up this issue, and I'm concerned that the people who are the grassroots people aren't going to be able to access the funding and support and training that they should get in order to do it. We have several active groups here in Oklahoma in my area. In fact, one group is out today looking for a woman who's been missing for about 2 months. And they have these kind of events that take place quite often. And then they're also concerned is the safety of our young people who get in on the internet, meet people, and then we don't hear from them again. And those things are very, very big concerns. But again, they don't have offices. They're just a group of women who really believe strongly in these issues. And if we could find a vehicle to help them, maybe even set it up to where a tribe can sponsor such a grassroots group, I think that would be very valuable.
Thank you. I appreciate that, and I agree. And I see Olivia Gray has some very valid comments and concerns. That's where we need to know, how do we get in touch with those grassroots groups? Who do we reach out to that is on the front lines of this? So that's something as task force members that you can let us know during listening sessions, on our tribal advisory committees, at any time. You can let us know of groups. I've had folks like the missing and murdered Dene relatives reach out and been able to meet.
This is the operator here, William Micklin on the line. You've been unmuted, so go ahead, please, sir.
Thank you. Will Micklin, Vice President, Executive Council, Central Council of Tlingit Tribes of Alaska. I'm also alternate primary at-large delegate for the Secretary's Tribal Advisory Committee. This is my second alternate in between. I've been primary for 2 terms. And in that time, we've often spoken about prevention of violence against women and children. And it really takes a lot of on-the-ground effort. Our concerns are several. One is that our FY18 and FY19 funding levels under the Family Violence Services and Prevention Act, the FVPSA, been drastically reduced from previous years. The reduction over the past 2 years has severely impacted the delivery of our critically needed services to Native family violence victims within Southeast Alaska. Since 2005, we received on average annual funding of $209,000 for FEPSA services. These are used minimally for staff support and training. The majority are volunteers and community members. The majority of the funding is used is for emergent services, including 3 women's shelters in Southeast Alaska. We entered into MOA and with subrecipient agreements with organizations that are Aware, Juneau, and Wish of Ketchikan, and SAFE of Sitka, all safe houses. And without adequate funding, these shelters will be affected if not closed. We're concerned at the funding reduction in the grant awards over the past 3 years. We received in 18 $170,000 in a reduction of 38,000, and then in 19 we only received 45,000 year to date. This is an essential pillar in our effort to address violence against women and children, which is a tremendous issue. It also is ancillary but critical to our efforts on suicide prevention, mental health issues, substance abuse. All of these issues go hand in hand. With the task force, we've been concerned that those efforts mostly, not all, but mostly escape Alaska and Southeast Alaska. There's been, I think, some emphasis on addressing cold cases. And, our issue is that law enforcement does not report crimes by tribal affiliation or ethnicity. So those FBI crime statistics lack the information necessary to address, to identify, to validate, and to fund efforts to address these tremendous and ongoing issues. As we find when fishing seasons are constrained, we get a lot of domestic violence because of pressure within households. And with the COVID pandemic, it's not any different. We see a significant rise in domestic violence and abuse. We see rises in human trafficking. We see rises in substance abuse. We are really looking for an explanation of the method and rationale that ACF uses to formulate the FEPSA funding levels to arrive at the drastically reduced funding amounts. We are also looking for focused implementation of the commission to address these current issues. We don't have reservations in Southeast Alaska except for Metlakatla. We don't have the data in FBI crime statistics to help focus funding. We are dependent on these programs that we've been actively engaged in for many years. Our Chief Justice, Michelle Demmert, has been a leader in these matters. One of our vice presidents, Catherine Edwards, has been involved in these efforts on both a regional and national level. But we need the assistance. We need the monies commensurate with the impacts and with the terrible adversity in our communities for these problems that we know exist, but just don't have the means to adequately address them. So those are our comments. Thank you very much.
Thank you for your work that you're doing in your community, and I certainly understand where you're coming from. And tomorrow we'll have the opportunity to visit with the Family Youth Services Bureau that funds the FIPSA that you're talking about. This framework, we want to meet people where they're at, whether it's prevention, intervention in their midst, if they're in the midst of it, And if they are a survivor and coming home to their community, how do we support them in a positive way? So I also want to know how, on the Health and Human Services side, we're not the prosecuting side, we're not the investigation side, we are the human services and the health services. How do we get the education out there? How do we go upstream? I mean, even further than early childhood, how do we help with mother's sacredhood and father's sacredhood and help parents to have supportive homes so the children aren't going to run away or go missing, and prevent domestic violence. You know, what I've seen, and I'd love to hear your thought on this also, is when I have visited our ANA grantees where our culture and languages are promoted, I'm seeing where our communities are coming together in a positive way. Our culture doesn't allow for the alcohol, for the gossiping and the bickering, and our youth have said, we want to see more activities like this. It's instilling our pride, our culture, it's building our communities. To me, I see prevention, I see positive community interaction and strengthening. That's what I envision when I see going upstream. What do you envision? What can we do to help support through our services at ACF and strengthening our families and going in a way that's not judgmental, that's meeting people where they're at, and that's providing services to help families be as strong as they can and as connected as they can in their families and in their communities.
So, can you still hear me?
Yes, we can.
So, if I might just take 1 minute. We've been collaborating with First Alaskans Institute to address the programs for mediation and reconciliation. We are not as interested in, to any extent and by any means, about prosecution, except for in the area of deterrent. But we are more interested in building the mental health, the cultural health, and the physical health of our tribal citizens, and we do that through collaboration. We do that through emphasizing our culture, protecting our children, protecting our most vulnerable segment of our populations, women as well as men, and finding means to fund that. And it's been, it's been a big problem with competitive grants. We have to compete for this funding on an ongoing basis. We are never certain that with these very short terms on the funded programs that they are not going to disappear at the end of that funding term, or the funds will diminish 1 year or one term over the next. So it's very difficult to build durable institutional systems that address these issues. They're here, they're gone, and then we find something else, and they're here and they're gone. So we really need to find ways to allocate so that we have consistent resources that folks can rely on. They know it's there, and they're under really what we've emphasized and included in our tribal court. We're applying our culture and our traditional law to these issues. We're not seeking to punish. We're seeking to reform, remediate, and improve. So I think we're all in agreement. We just need to find the resources to apply to this problem on a sustained basis that are focused on what is true in each of our villages. And it's different in each village. And we ought to have the control over the use of funds that speaks to and addresses those problems that are unique to each village. It may be different in one village as to the next, but those distinctions are important. And so the program, we try to recognize that, but at this point we have to fit into a fairly inflexible program requirements that don't make that distinction. So those number of issues are what we look to for meaningful changes to how programs are implemented.
Thank you. Thank you. I certainly understand and have heard and seen, the grants, they're great, they're helpful, they go away, the program goes away. So how do we help build programs that are there for longevity? So thank you for that.
If we have any other tribal leaders that wish to provide comments or input, please select the raise your hand icon at the middle top of your screen or press *# on your phone to be put in the queue. Thank you.
Hello, this is Ryan Goudet again from the Critter. Is somebody else speaking at the same time? If not, can you hear me?
Okay, go ahead.
Can you hear me?
Yes,
yes, we can hear
Hello?
you.
Oh, okay, sorry, it's hard to tell sometimes. But Jeannie, I do want to comment on the prevention awareness. Very important that our people know how serious this is across the nation. And our young women in our school, the Elk Hills Ojibwe school, were making a stand. They were making it known. They were doing things, and sometimes it's best, you need to present that at all levels, but when the kids are speaking, their voice even gets louder. And so any way that we can keep that awareness and the education, prevention going, we need to, because we are going to be saving lives then. And how serious this is. People do not know really how serious this is and how justice has not been done for our people, and when it reaches that level. And so the efforts that you have going here, it's fallen on some ears now that it hadn't before. So we need to keep going in that direction, to keep having those join us in that effort to prevent and to address what's been happening for years. And within our community, we have cities around us that our people get attracted to, whether it be for employment or family, whatever the cause may be, and they get caught in that because a lot of our people live in poverty. So they're easy targets, and we have to combat that. And then you mentioned media, social media. You mentioned technology. Oh, there's another piece right there. You better believe they target our people, and they will grab them in a heartbeat. And so just to keep the education going in any way that we can is important. And so any kind of resources that we can get our hands on or keep adding to or keep implementing for all of us to be able to utilize is good, Jeannie. Whatever ways that you guys can keep enhancing that and building on that, again, we appreciate that. So I just wanted to throw that in there because it's something that we've been trying to keep moving forward with, and whatever ways we can, we need to keep doing it. Our people have been targeted for whatever reason, and that needs to stop. So, but thanks, Jeannie. I appreciated being part of the conference this afternoon.
Thank you so much. Thanks for your comments.
We have one more caller in the queue.
Hey, great. Can you state your name, title, and tribal affiliation, please?
No more callers in the queue.
I'm sorry, no more or one more?
Sorry, no more callers. No more.
None. Okay, I'm sorry, I misunderstood. Okay, well, I just want to say thank you for your comments on this. I want to say thank you to all for keeping the memories of those that have either been missing and never been found, or those who have found and never had closure or justice. Thank you. We want to continue to do so. We have had we are going to have a consultation with our iLead youth, and also youth from CNAY with Operation Lady Justice. We need to hear from youth. On the task force, I'm representing Department of Health and Human Services, but I'd like to know how we can get to the communities and really get to those that are on the front lines of this issue, hear from survivors, hear from families, and know how we can really make a difference in this issue. I'm trying to emphasize this is not just a Native American issue. This is an American crisis, and we need all of America to respond to help us with this. This is happening in urban settings, and I believe people want to help, but they, one, don't know that it's even happening, and when they find out, they don't know how to help. I have an op-ed that's coming out in Fortune magazine to discuss this, hopefully in the next couple of months. But again, we want to provide the tools at ACF and across HHS so that we can make a difference. But we need to hear from you and know what's working, what's not working. On the task force, we have Department of Justice, Department of Interior. They're the investigative side, but we need to partner with them. I'm seeing a lot of comments on law enforcement. I love our law enforcement. I've traveled and done night shifts with several of our law enforcement in Indian country, seen what they go through. It's their relatives that they respond to. It's those relatives that there's investigations, and they are equally concerned, hurt, wanting to make a difference also. But there are law enforcement officials that sometimes when they hear that it's somebody that has history of substance abuse or disappearing, they don't always get that prioritization of looking for them right away. So we want to educate on the importance of responding to all of these as soon as possible. So there is a role that we can play in training also on what is human trafficking, what is the cultural way to respond to some of these calls for that might come in. So there are things that we do have a role in with partnership with law enforcement, but it will not be the investigative side. It's a huge issue to tackle, but one that cannot be overlooked anymore. So even though it's 60 days for comment period, we want to hear from you, but we don't want that to end at 60 days. We want to continue to hear from you, your dialogue. You have this ANA commissioner email. It's open all the time, 24/7, 365 days a year. So you can write your comments anytime. You can visit with me by phone, by email when you come to DC and things are open up again. So keep that in mind. I know it's 6:03. We're past our cutoff time. It's been a long afternoon. I appreciate so much that you all have participated, for your comments. There's a lot to think about. Thank you for your participation. We look forward to continued discussion tomorrow. We are starting again at 1 p.m. Eastern Daylight Time. If you haven't registered for tomorrow's session, it's not too late. Tomorrow's going to include the Office of Child Support Enforcement, the Family Youth Services Bureau, where we'll have important programs such as the Runaway and Homeless Youth, supporting domestic violence shelters, adoption and foster care. We also have the Office of Community Services, which includes TANF, LIHEAP or LEHAP, and the Community Services Block Grant. And we'll hear from Director Chan of the Office on Trafficking in Persons. We have a lot of great activities taking place between ANA and the Office on Trafficking in Persons. You won't want to miss out on hearing some of the resources that are available. As a reminder, the record for today and tomorrow's consultation will be open for 60 days, and written testimonies may be submitted during this time to anacommissioner@acf.hhs.gov. In addition, the comments that you're posting today during our web session will also be part of the record. And so I want to thank you, and Chairman Sullivan, you've been a gracious co-facilitator with me today, and I thank you for that. And I'm going to ask Chairman Sullivan if you would lead us in a closing prayer.
Thank you, Commissioner. I just wanted to say it's been a real honor for me to work with you today, and I'm looking forward to tomorrow with the understanding that we did have some technical difficulties, but it seemed like we got through that as we moved on through the session. Please pray in your own way and in your own spirit. Heavenly Father, thank you for this day. Thank you for the many blessings Thank you for keeping our spirits alive here on earth to carry on our traditions and bring back the ones that were once lost. Please, Lord, give us the guidance in your way, Lord, your path. Please give us the strength and knowledge to help our tribal communities be better for our future, the future of our children, our grandchildren, and beyond. Please protect our people and give us the guidance to keep our Native women safe, our children safe, and let the negative things that are happening be cast out and shield of protection around them. Heavenly Father, please protect all the people that are protesting for equal rights and that are raising awareness of inequality. Please protect our police and give them and all of us the ability to understand each other in a good way. Jesus, please remove this COVID-19 virus from this earth. Put your healing hands on those that have been impacted by this virus, and please give us the knowledge to the doctors and help us rid this virus and heal the sick. Lord, heal all of the people in pain at this time. Lord, bless those that are being celebrated for achieving an academic stage in their lives. Please give them directions to do well in this world. Give them the strength to follow their dreams and goals. Lord, bless all the people on this call and the communities that are represented. Bless all of our Native peoples. I pray this in your name, Lord. In Jesus' name, amen.
Thank you, Mr. Chairman. Thank everybody, and we hope to hear from you again tomorrow. Have a good evening.